Good afternoon, everybody. Appreciate you being able to join us on a Friday afternoon, week before Christmas, to be able to discuss this rule. I know that there's a great interest in it and a great interest in both understanding it and making your opinions known about the rule, your suggestions known about the rule. And so we really look forward to hearing from you and having this discussion. I just want to go over, the purpose of the meeting and make sure that sort of people understand what we're doing here and what we do not really intend to do, so that we can make the most out of this meeting and that we can set the table properly for a constructive advisory committee meeting in the near future. The first thing that we're going to do today is hear from Eric Berg, our Deputy Chief of Health and Standards, to go through the key provisions of the rule. I think it will be useful for everyone to hear an overview of the rule before we start hearing comments, so that this may resolve some of the questions or comments that you may have, and we can narrow our focus as we get your feedback on the rule. And then the second thing we want to do today is establish a focused agenda for a future advisory committee meeting. What we'd like to do is, focus comments, if you would, on what changes you want to the rule, the agenda items that you'd like to see in a upcoming advisory committee meeting, with ideas kind of focused on specific changes. As we said in the email that we sent out prior to the meeting, we're going to ask participants to identify the provisions of the rule that they wish to address, to give a brief description of the change that they wish, whether that's a deletion of a portion of the rule, a change to a portion of the rule, or an addition to the rule, with a brief explanation of what the change would be, language if possible, and what you want the change in the rule to achieve. And then we'll be able to prioritize these issues for further discussion at the advisory committee meeting. This is very much a pre-meeting where we're going to be taking an intake and we're going to be doing an inventory of the issues that people want to talk about, so that we can prioritize these issues for the future stakeholder meeting. We may have to put a time limit on the number of issues each participant can address, or a time limit on the amount of time that people take, depending on the number of people who get in the queue and how much time folks are taking. So we'd ask that, just to maximize the time that we have and make it the most constructive, if we'd appreciate it if people would avoid extensive general commentary on the rule, the need or lack of need of the ETS and so forth, so we can really focus on improving it, simplifying it where we can, making it more effective, without compromising safety, or looking at issues where we can make the rule better. So with that, Eric, why don't you go ahead and provide your overview?
Okay, thank you. I'll give a brief overview of the regulation. Again, we have an email here. If you don't understand something of the regulation, you can email us at that email address. We're getting very, very many emails, so we can't respond to each one individually, but we are assembling, and we have already assembled FAQs. So as we get questions, we are going through them all and adding to those FAQs. So you can look at those frequently to see different questions addressed. And below that is the web address where we have many resources on this emergency regulation. As I mentioned, the FAQs, there's also a fact sheet, a sample program that employers can use, sample COVID prevention program. So that address right there has all that information. So I'll get started. Okay, the COVID-19 prevention regulation became effective November 30th, 2020. It's an emergency regulation. Again, here is the web address for the FAQs that I mentioned. These regulations have many provisions similar to those required by 3203, which we have been enforcing since the beginning of the pandemic. That includes identification and correction of COVID-19 hazards to employees, use of face coverings, physical distancing, and others. And this quote is from our FAQs. And as employers implement these new regulations, OSHA enforcement personnel will consider an employer's good faith efforts in working towards compliance. But some aspects, such as eliminating hazards and implementing testing requirements during an outbreak, are essential. So that is in our FAQs that we are taking into account employers' good faith efforts to comply with these regulations. Okay, the emergency regulation consists of 5 new sections. 3205 is the main regulation on COVID-19 prevention. 35.
The microphone is not working.
What's wrong? Sorry. Okay, I heard comments. Something's wrong with the slide. You cannot see my screen.
You're fine, Eric. I think somebody was unmuted.
Oh, okay. Sorry. So there's 5 new regulations. 3205 is the main COVID-19 prevention regulation. Then we have 2 sections on outbreaks, 3205.1, which is for COVID outbreak, and then 3205.2 is for major outbreaks. And then we have 2 sections following those, one on transportation of employees, on employer-provided transportation. And then lastly, there is employer-provided housing, and then lastly, employer-provided transportation. I got those backwards. So 3205, the main COVID prevention regulation, starts with the scope, which explains who this regulation applies to. So it applies to nearly all employers. There's some specific exceptions. So workplaces with 1 employee who does not have contact with other persons, employees working from home, and then employees covered by Section 5199, that is the Title 8 Aerosol Transmissible Disease Standard, which applies to healthcare and some other industries such as corrections. So those are not, employees covered by that section are not covered by this emergency regulation. However, this emergency regulation would cover certain administrative, payroll, employees of a hospital and other 5199 employers. Okay, moving on. On section 3205, there is 9 definitions. So I'm not going to go into those here. There's a few key definitions that I will get into later where they are used in the actual regulation. The first part of 3205 is the written prevention program, a COVID-19 prevention program. And it builds on the IPP and existing COVID-19 prevention guidelines that have been in existence for many months. So there is communication with employees on COVID-19 hazards, identifying and evaluating hazards in the workplace, investigating and responding to COVID-19 cases and illnesses, correcting COVID-19 hazards, training of employees, physical distancing, face coverings, additional engineering, administrative, and PPE controls, illness reporting, record keeping, and then employee access to the COVID-19 prevention program. And lastly, there's exclusion of workers and return to work criteria. So I'll explain each of those in a little more detail. So the first part of the written prevention program is communication with employees. It must be readily understandable by employees and include how to report to COVID-19 symptoms to the employer, exposures, hazards in the workplace, and employees must be allowed to report these issues without fear of reprisal. The employer must include information on COVID-19 hazards in the workplace and the employer's policies and procedures to protect employees from these hazards. The next bullet is procedures the employer may have for accommodating employees with elevated risk factors, So the regulation does not require the employer to have these accommodations. It just requires that an employer has such accommodations that these be communicated to employees, because accommodations is addressed by a different agency. Access to voluntary COVID-19 testing, and that could be different methods of doing that: community health centers, local health departments, or the employer. And separately, I'll talk about when COVID-19 testing is mandatory. The next part of the written COVID-19 prevention program is hazard identification and evaluation. First thing is that employees and their unions must be allowed to participate in this identification and evaluation of COVID-19 hazards. So this part would include symptom screening of employees. This does not have to be done at the workplace. The employer can request employees do this before they come to work. Next is procedures the employer has to immediately address COVID-19 cases in the workplace, conducting a site-specific evaluation of COVID-19 hazards, including all person-to-person interactions. In indoor locations, determine how to maximize outdoor air, and if it is possible, to increase the filtration efficiency of an existing ventilation system. So it does not require putting a new ventilation system, just maximizing the existing system that is in place. And then lastly, conducting periodic inspections of the workplace for compliance with prevention policies and to identify new COVID-19 hazards. The next section is responding to COVID-19 cases in the workplace. Firstly, determine when a COVID-19 case was last in the workplace, the date of testing onset of symptoms, determine which employees were exposed to COVID-19 case, notify these exposed employees, their unions, and other employers within 1 business day. And I should explain that the definition of exposure I will go into further later on, but it's basically being within 6 feet of the COVID case for a cumulative 15 minutes in a 24-hour period during the high-risk infectious period of that COVID case. But I'll get into that a little bit later when it's used more. Then offer testing to exposed employees at no cost and on paid time. This testing does not have to be at the workplace and can be provided by the local community clinic or the local health department, as long as there's no cost to the employee. Next, investigate the exposure, whether workplace conditions may have contributed to COVID risks, and corrections that could be made to reduce employee COVID-19 exposures. And the last 3 parts I will get into later on those sections on record keeping, excluding employees, and return to work. The next section is correction of COVID-19 hazards. So this is correcting unsafe or unhealthy conditions, work practices, policies, and procedures, very similar to what is in the IPP. And so in other sections of the regulation, we're asking employers to identify and evaluate hazards, correct those, and also during the illness investigations, hazards identified there, correct those hazards, and also implement controls required by the other sections, such as face coverings, physical distancing, engineering controls, administrative controls, and personal protective equipment, which I will describe a little bit more later. The next section is employee training. So there's several topics here that the employee should be trained on, including the employer's COVID-19 policies and procedures, employee benefits available related to COVID-19, the modes of transmission of COVID-19, principally that it is an airborne infection, physical distancing, the need to combine face coverings with other controls, and physical distancing, as we know that the physical distancing of 6 feet does not prevent infections, so it needs to combine with other controls. hand washing, face coverings, and the fact that face coverings are not respiratory protective equipment. And then COVID-19 symptoms. If the employee has symptoms, recommend them not coming to work and get a COVID-19 test. That is not a requirement in the regulation, but is a recommendation, and then employees get trained on that recommendation. The next sections are on physical distancing and face coverings, very similar to what's already been in guidelines for quite a long time. So physical distancing of 6 feet between persons, and the employer has the burden of demonstrating when that is not possible. Face coverings required whenever indoors and outdoors if persons are less than 6 feet apart. There are several exceptions for eating, when someone is alone in a room, using a respirator, certain medical conditions that don't allow for use of a face covering, when it's not feasible to use a face covering due to the work. And when it's not feasible to use face coverings, regular testing twice a week is required.
Excuse me, I have a question.
Sorry, that was, I heard something.
Yeah, is it appropriate to ask questions about the sections that you're going over right now, or will there be a period for questions at the end?
If you have a clarification question, you can do that later. But we ask that any more general questions be sent to the email I posted, and I'll post again, because I won't have time to go through that.
Okay, thanks.
Given we have 1,000 people on here, so we won't be
Understood.
able to get to all questions here. The next section is C8, engineering, administrative, and PPE controls. So engineering controls include solid partitions at fixed workstations when distancing is not possible. And then maximizing outside air when the AQI is, except when the AQI is greater than 100. Maximize the quantity of outside air, and there's an exception if the air quality is not healthy. Next is administrative controls. Cleaning of frequently touched surfaces. The cleaning requirements are similar with guidelines which have been out for a long time. For personal protective equipment, do not share. Other personal items, do not share if possible. If not, they have to be shared, then clean and disinfect them between people that use them. And then hand washing and use of hand sanitizer, again, very similar to guidelines that have been out for many months. On PPE, evaluate the need for PPE to prevent exposure to COVID-19 hazards. Doesn't require any specific PPE except for some special circumstances, such as eye and respiratory protection for aerosol generating procedures not covered by the aerosol transmissible disease standard is mandatory. And that would be, one example would be dentistry when it's not covered by the ATD standard.
Eric, I'm really sorry to interrupt. This is Rob Mutri, Cal Chamber. But I just wanted to ask if Bish Tran could please mute themselves. Repeatedly clearing their throat and hearing dings through their line is making it hard to hear you, Eric. My apologies.
Okay, could that person please mute? Or, thank you very much. Apologize for that. The next section is C9, reporting, record keeping, and employee access to the written program. So it requires employers report cases to the local health department when required by law. Report serious illnesses that are work-related and deaths to Cal OSHA. There's no change from the existing requirements for that. Maintain inspection records and training records as already required by 3203. Make the COVID-19 prevention program available to employees and their union representatives, and then record all COVID-19 workplace cases. The next section is on exclusion of employees. This is to prevent outbreaks within the workplace. The following employees have to be excluded: those that test positive for COVID-19 or those who had COVID-19 exposure. And there's exception for those employees that can work from home or be otherwise isolated from other people or other employees, sorry. And there's a requirement of preservation of pay and benefits. There's some limitations on this. It's only available if the employee is able and available to work. So if they're too sick to work, this would not be required. And the employer may require employees to use sick leave for this. And the employer may offset payments by an amount the employee receives from other benefit sources. There's another exception here that if the employer can show the exposure was not work-related, then this provision does not apply. The next section is on returning employees to work. So there's different categories. For symptomatic COVID-19 positive workers, 10 days have passed since they first had symptoms, and they've had 24 hours without fever and symptoms are improving. So if those all apply, then the employee can return to work. For positive workers that never had symptoms, it's just 10 days after they took the test. And then thirdly is exposed workers. These in the regulation, it does say 14 days, but this was changed by a recent executive order from the governor. So it is now 10 days for most workplaces. And this will be on our FAQs as well, with the link to the CDPH recommendations for this, which will now be required by this regulation rather than 14 days. So it's a little bit less than before. Okay, some of the key definitions apply to some following requirements is COVID-19 exposure. So that is being 6 feet of a COVID-19 case for a cumulative total of 15 minutes or greater in any 24-hour period within or overlapping with the high-risk exposure period. So, and this definition applies regardless of the use of face coverings. And exposed workplace, which will apply in the next sections I'm going to cover regarding outbreaks, is any work location, working area, or common area of work used or accessed by a COVID-19 case during the high-risk period or high-risk exposure period, including bathrooms, walkways, hallways, aisles, break, or eating areas. The exposed workplace does not include buildings or facilities not entered by a COVID-19 case. And in our FAQs, which I've referred to a couple times earlier, we clarified this, that we do not expect employers to treat areas where mask employers pass through momentarily as being an exposed workplace. There's no interactions or congregating in those areas. So you can look at that in our FAQ. So like a lobby to an office building where people just go through there on their way to on their floor, that would not be an exposed workplace, as an example. High risk exposure period is another definition used frequently in the regulation. It means the following time period. For symptomatic persons that developed COVID-19 symptoms 2 days before they first developed symptoms, beginning then, until 10 days after symptoms first appeared. And again, 24 hours have passed with no fever and no medications, and symptoms have improved. For asymptomatic persons with no symptoms, 2 days before they had the positive test until 10 days after the positive test. So similar. Okay, the next section we have is regarding outbreaks, 3205.1. An outbreak is 3 or more cases in a 14-day period in an exposed workplace. And the exposed workplace, as I explained earlier, is the location where the COVID-19 case was present. So it requires immediate testing of employees in the exposed workplace. Immediately means, as soon as the employer is able to do so, because we know there's some obstacles to obtaining that. And then repeat the testing 1 week later, continue testing until there are no new cases in a 14-day period. And then exclude the positive cases and exposed employees as explained in 3205. The same requirements apply on excluding employees and returning them to work. investigate and determine the workplace factors they may have contributed to the COVID-19 outbreak, review and update COVID-19 prevention policies, procedures, controls, consider additional engineering, administrative, and PPE controls, and notify the local health department of the outbreak. Next is major outbreak, which is 20 or more cases in a 30-day period in an exposed workplace, which was defined earlier. It's similar requirements to 3205.1 for a normal outbreak or a smaller outbreak with some enhancements. The testing requirement increases to twice weekly, and it requires the employer to enhance ventilation filtration efficiency where possible. Evaluate use of HEPA filtration units for poorly ventilated areas. Evaluate the need for respiratory protection, and consider halting or all or part of operations to control the virus. So it doesn't require those, but does require those to be considered and looked at. The next section is on employer-provided housing. It requires employers to prioritize housing assignments. So first priority would be persons that normally maintain a household together outside of work, such as family members. And next is residents who work together. And then the other requirements are very similar to the main regulation and guidelines that have been out for many months, such as physical distancing, face coverings, cleaning and disinfecting, symptom screening. Again, we have COVID testing here, required if there's a COVID-19 exposure, COVID-19 symptoms, or the health department makes that recommendation. And then isolation of COVID-19 cases and persons with COVID-19 exposure. The last section is on employer-provided transportation. Again, it requires prioritization of assignments. So first prioritization would be employees residing in the same housing unit be transported together. And secondly, employees that work in the same crew or work site be transported together. And the other requirements, again, are very similar to standard COVID-19 prevention. So it's physical distancing, 6 feet while waiting for the transportation. It's reduced to 3 feet in the vehicle because it's not easy to do 6 feet distancing in a vehicle. So that is reduced to 3 feet. Face coverings, symptom screening, and excluding persons from the vehicle that have symptoms. Cleaning and disinfecting, ventilation, which includes opening the windows and not recirculating the air. And then lastly, hand hygiene. And again, if you have questions, please email us at rs@dir.ca.gov. And we have our resource page here for our FAQs, our fact sheets, our sample programs. So please revisit the site frequently as we update it on a regular basis. Thank you very much. That's what I have for now. Thank you. And then next on our agenda, we'll begin an open discussions on key provisions and proposal for specific clarifications. So I'll let Kathy moderate people who have raised their hands, and so we can begin to take your ideas on how we can make improvements and clarifications to the standard and plan for our upcoming advisory meeting. Thank you.
Thank you. So we have a number of hands that are raised who would like to make comments. So what I'm going to do is call them in the order that we receive them. When I call you, please unmute your microphone, state your name and the company that you're with, and make your comment or proposal. Thank you. So first, in the queue, we have Sophie Geze. If you can unmute and go ahead and make your statement.
Thank you for providing an opportunity to comment on the emergency temporary standards. My name is Sophie Gazai, representing Airlines for America. Airlines for America advocates on behalf of its members to shape crucial policies and measures that promote safety, security, and a healthy U.S. airline industry. As indicated in our written comments submitted November 24th, the new regulation have a significant effect on our members' operations and California passengers and shippers. Airlines have thousands of flight crew employees who technically only work when on board an aircraft in operation. 3205C3B4, 32051B1, and Section 32052B COVID-19 testing requirements, including the requirement to test employees during work hours, is completely infeasible and will be impossible to implement. Requiring carriers to test crew members when they report for duty would introduce delays in schedules that will cascade throughout the carefully choreographed national system of airplane takeoffs and landings and severely disrupt operations. The stringent quarantine requirement by ETS will upset supply chains and delivery of all other critical services, including the medical supplies, equipment, and personnel necessary to combat COVID-19, and could stall efforts to distribute the vaccine. The return to work employee exclusion from the workplace provision 3205C10 contradicts CDC guidance. To ensure continuity of essential functions, the CDC has issued guidance removing quarantine requirements to allow critical infrastructure workers with known exposure but without symptoms or a positive test to return to work. In addition, as provided for in our most recent comments submitted yesterday, we believe that these regulations wrongly overreach to an area that the FAA has addressed. The FAA regulates safety and has provided guidance in this area. CFO 20009 addresses these concerns and is consistent with the most recent CDC guidance promulgated. We've also provided our comments on the written comment for 3205A1, 3205C3B3, and Section 32054. Okay, thank you again for this opportunity to raise these concerns.
Thank you, and thank you for keeping your comments brief. I wanted to address a couple of issues that I've seen in the chat before we recognize our next speaker, our next commenter. A lot of people have asked about questions and the need to ask questions to clarify and frame their comments. If someone needs to ask a question in order to frame their comments, we'll try to answer it. There might be difficulty in answering every question just because of the precision that's required, and it might not be possible to do it in this forum, but we'll do our best if it's helpful. And I think that might help narrow some of the issues that people may have in their comments. Thank you for keeping your comments brief. Thank you for your comments. I do want to address one of the issues, and I'm not going to respond to everything, but where I see an opportunity to clarify, we'll take that. Testing during working normal hours is a term of art that's used in other standards that we have that simply means that it's during paid time. So it doesn't require that you not adjust your schedule or other processes. So anyways, thank you again for your comments. We'll review your written comments closely. Thanks, Kath. Go ahead.
Okay, so next in the queue, we have Melissa Patek. Again, reminder to please keep your comments brief. Thank you.
Great, thank you. Thank you so much for this opportunity to provide comments at the stakeholders meeting. My name is Melissa Patek. I'm Vice President, Senior Counsel with the Motion Picture Association. That's the trade association whose members are the leading producers and distributors of filmed entertainment content across all platforms. Our members are Disney, NBC Universal, Netflix, Paramount Pictures, Sony Pictures Entertainment, and Warner Brothers. So we have submitted a full letter of comments, so which I'm not obviously going to relate all of that. Let me just take a couple of high-level provisions. since you wanted the citations to the provisions, but there's a little bit of background information I will give you after that. So first of all, and again, this is not exhaustive, but so the highlights, 3205C10C, maintenance of earnings while a worker is excluded from the workplace. California law and a local LA ordinance specify a cap on the amount paid to an employee while out due to COVID-19. We have a collective bargaining agreement specifically addressing return to work during COVID-19. When I say we, our sector, and it addresses this issue and it provides for an amount that exceeds state and local law. I would point out that 3205C10C provides no cap on either the number of days an employee must be paid while excluded from work or on the dollar amount of that pay, and that's a conflict with our collective bargaining agreements. Another provision, 3205C11, our return to work agreement sets forth, the criteria our return to work agreement sets forth in this section, frankly, is inconsistent with current public health guidelines on this issue. The return to work agreement addresses this issue and provides that employers will follow the CDC guidelines as well as state and local public authorities, health authorities. Cal OSHA should conform its standard to the guidance of public health authorities who do have the expertise in this area. Testing requirements, several sections here, 3205C3B4, 3205.1B1, 3205.2B. Again, our return to work collective bargaining agreement has specific provisions on testing that apply to all cast and crew members. In addition, the return to work agreement also provides for compensation for employees who are tested. Cal OSHA's one-size-fits-all approach on this important subject, which requires that all testing take place during work hours, does not take into account the unique circumstances of film, TV, and streaming production, which sometimes requires that testing be done outside of normal work hours. So just by way of background, and again, there are more provisions in our letter, but just by way of background, our sector has been authorized to resume work by the governor and by local authorities consistent with safe work protocols, which were developed by the industry-wide Labor Management Safety Committee under the guidance of an infectious disease expert from UCLA Health. And building upon the work of the Safety Committee, the employers and the guilds and unions that represent the employees in production engaged in collective bargaining to address all the issues of achieving a safe workplace. After more than 3 months of bargaining, a comprehensive return to work agreement was reached in September and productions resumed working. I can go through the highlights of some of our practices, but it's important to point out that these practices have resulted in a very low positivity rate, about 2.2% among the production employees since September. This ETS creates new responsibilities for employers, some of which are inconsistent with state law and public health guidance and the obligations set forth in the return to work agreement. We submit that employers subject to collective bargaining agreements that comport with all public health guidance on COVID-19 should be exempt from the ETS. As we've seen throughout the COVID-19 pandemic, public health guidelines have changed over time. The collective bargaining process is uniquely suited to ensure that the workplace adapts to the current public health recommendations. This ETS, frankly, is already outdated as the public health guidance on quarantine in certain circumstances has been reduced from the 14 days specified in the ETS. There is ample authority in California law for allowing standards set through collective bargaining to govern the employers and employees subject to such agreements. Our letter includes such examples. So I won't take more time to detail the safe working protocols. We're happy to share them with you and the advisory committee, and we look forward to that advisory committee process. Thank you so much for the opportunity to speak today.
Thank you, Melissa. Okay, so next on the queue, we have Helen Clary. Go ahead, Helen.
I'm sorry, but you know, instead of these political individual long position statements that can be shared in writing with OSHA. I mean, isn't this supposed to be really to clarify what's going on and to help us at the local level to understand them and implement them? So can you ask those people to, if they have those type of position statements, to just direct them directly to you so we can get to the point of this call?
We can, Eric posted an email for questions. We can also use that email to accept written comments. If someone wants to just briefly summarize written comments, they can send their written comments to that email, and we can hear from more people, and we will assuredly fully review those comments and take them into consideration in the advisory committee. So yes, we can do that. And I would encourage people to do that.
Could you include that email in the chat section once more, please?
Sure.
Yeah, I just did. I don't know if you see it, I'll type it in again.
Thank you.
It is, for those of you who don't see the chat, it's or on the phone perhaps, it's rs, letter R, letter S, at dir.ca.gov. rs@dir.ca.gov. Thank you.
Hi, this is Helen. I can't unmute my video. It says that the host has locked me, has stopped it. There we go. There we go. Okay. So I put together a breakdown through a presentation that I think will make it much faster and cleaner to go through. So I would like to share that. Okay. Can we see that there?
Yes.
Okay, stop me if you can. Thank you. I'm Helen Cleary with the Philmar Regulatory Roundtable, and we wanted to highlight 3 concerns today, the major concerns that our members are dealing with. There are other concerns that in addition, but for this purpose of this meeting, we'll do the 3 today. Number 1, 3205.1 and 3205.2, specific to COVID-19 testing. The concerns are the triggers to test all employees when there are 3 and 20 cases, the requirement to provide immediate testing during working hours, and the requirement to test on specific intervals. The reasons that we're requesting changes for this is that a trigger of 3 and 20 cases is a one-size-fits-all approach. 3 cases for 1,000 employees is just not equal to 3 cases for 20 employees. An effective testing strategy should consider the number of employees, the implemented control measures that are in place, the availability of testing resources in the local community, and already implemented on-site testing programs, which many of our members have in place and have been doing for months. In addition, specific testing intervals may not provide additional value. They may not be feasible, practical, or effective. Employers may not have control over testing resources, including scheduling, and incubation periods will vary. Finally, testing resources are dependent on the community, the outbreak, the regions, the locations, and we do not think that employers should be responsible for testing that is reliant on public health resources. So our recommendations for this is that a testing strategy needs to be based on the percentage of positive tests and the number of employees, and that the division should permit employers to work with CDPH and other local health officials on a testing strategy instead of having these blanket requirements. And those strategies include location, type of operation, community resources, and community outbreak. Our second concern is 3205 C10 and 11, the exclusion and return to work, specifically the 14-day exclusion and quarantine, which we understand is now down to 10. But we want to address that employers are required to offer testing, but a negative test cannot be considered to reduce that quarantine time. It's also not in alignment with what CDC is suggesting. So the reasons for our changes is that the CDC has options to reduce quarantine and allows a negative test to reduce to 7 days. And they actually use in their guidance that reducing the length of quarantine may make it easier for people by reducing the time they cannot work. So they're considering the workplace for this. Residual post-quarantine transmission risk is low, and that the executive order even states that CDPH based their decisions, their guidance on CDC. However, the CDPH guidance to reduce quarantine, allows 10-day reduction, allows a negative test to reduce quarantine to 7 for, quote, essential critical infrastructure workers, but that's limited to healthcare, emergency response, and select social service. It does not include the original 13 sectors that were identified back in March. It also only applies to asymptomatic. So based on this, I want to bring up the question, how do we prepare for the next change in guidance from CDC and CDPH? This change that came out this week was 15 days after the effective date. So our recommendations are to allow for a 7-day reduction to all 13 sectors of essential critical infrastructure, and for the division to create additional flexibility within the rule for new scientific guidance that won't require the need for an executive order. Our last concern is 3205C8, other engineering controls, specifically the requirement for partitions at fixed locations. The section uses the language not possible, and that's just inappropriate for a standard. Installation of solid partitions may not be feasible or safe for employers. So because it may not be feasible or safe, our examples from our members are that employees may need to work in teams, specifically when performing surgery in vivarium facilities and in laboratories. They cannot be separated by partitions. Solid partitions may not be able to be installed in vaults and in boilers, and these spaces are small, which limits the ability to social distance. So our recommendation for this is to change the language to you can see in the green, at fixed locations where it is not feasible to maintain the physical distancing requirements, the employer shall install cleanable solid partitions when practicable. Again, privacy, confidentiality, complexity, organization, those are our general concerns in addition to others, and we'll continue to provide feedback when we have more examples and time for that. Thank you. Thank you for your time. Thank you for putting this together on short notice. We all really appreciate it.
Thank you, Helen. Okay, so next on the queue, we have Michael Miller. Again, please state your name and the company that you're with, and go ahead, Michael.
Hey, Michael, before you start, can I just mention something real quick? Folks are putting requests for the slides in the chat. We're not going to collect those emails, but we'll post the slides and make those available on our website for people to download. Thank you. Go ahead, Michael. Sorry for the interruption, Mike.
No worries. Thank you so much, and good afternoon, everyone. And thanks for putting this together. It's a really important meeting, and I don't envy you trying to fix this ETS as a monumental task, and I don't envy what you have in front of you. I mean, family businesses are being shut down for good. People's lives and livelihood are at stake. Specific to the ag industry, we live in a state where ag housing has very strict restrictions, and this ETS significantly amplifies those restrictions, potentially leading to a shortfall in desperately needed housing. To me, it's shocking that the state's own Project Roomkey has fewer restrictions than the employer-provided housing under the ETS. To say that Californians are confused and frustrated by the arbitrary nature of these requirements is an understatement. Consequently, I want to predominantly focus on the immediate problems employers are facing in trying to comply with the ETS and ask for your guidance and direction. I appreciate that the Ag Conference Call Coalition was facilitated by CDFA last week. I appreciate Eric Berg's statements about his intent to address unintended consequences, but those unintended consequences are plenty and of serious concern. So let me address 4 of them and offer some potential solutions. I appreciate Cal OSHA's assertion that the board did not intend to apply this ETS to housing for the harvest. But as many employers continue to arrange for housing through that program, they must comply with the ETS as written. Consequently, the EPS must be amended to make it clear that the ETS does not apply to this program. This could include a simple sentence as follows: housing does not include housing provided under a program known as Housing for the Harvest, which was announced by the governor on July 24, 2020. In the short term, we ask that Cal OSHA put out some guidance making this clear. This kind of guidance is essential because we understand that the ETS can't be amended for several months. I also appreciate Cal OSHA's assertion that the board did not intend to create conflicts between state and federal law as it relates to ag employee housing. It is not realistic to ask an employer to choose between complying with either the state law or federal law, but not both, especially where this ETS will ultimately diminish housing availability. Where those conflicts clearly exist, we ask for clarifying amendments to the ETS. I'm happy to assist board and division staff in drafting that language. We also ask that in the short term, Cal OSHA provide guidance to make it clear that where the ETS is in conflict with federal law, the employers are not required to comply with those provisions of the ETS in violation of federal law. I further appreciate Cal OSHA's assertion that the board did not intend to require daily cleaning of a hotel room that is rented by an employer to help quarantine a COVID-19 case. However, again, as written, the ETS creates a huge problem as hotels are not cleaning rooms daily, and this is according to guidance from Cal OSHA, CDPH, and CDC. Rooms are being cleaned between 24 and 72 hours after each guest stay. That is according to the guidelines. Consequently, this regulation must be amended to reflect that existing guidance. This is not as easy as removing, this may be as easy as removing hotel and motel rooms from the definition of housing, and then adding the following. If a hotel or motel room is utilized for housing an employee, the room shall be cleaned and serviced by the hotel or motel operator according to the COVID-19 industry guidance, hotels, lodging, and short-term rentals, issued on July 29th, 2020. Again, in the short term, we ask that Cal OSHA issue guidance to make it clear what is required of an employer who rents a hotel room to help quarantine a COVID-19 case. And finally, I appreciate that the board has asserted that they did not intend to create a requirement for employers to prove a negative for cases where a COVID-19 exposure happened away from the workplace. Even though an employee was exposed away from the work site, the employer is required to provide paid leave unless the employer can prove that the COVID-19 exposure is not work-related. How does an employer prove this negative? So I would say that the exception needs to be rewritten entirely. I suggest inserting the following language. Exception 2, subsection C, 10C does not apply where there is a lack of substantial evidence that the COVID-19 exposure is work-related. Again, as this regulation is not going to be amended soon, in the short term, employers need guidance on how to meet the test of demonstrating that the COVID-19 exposure is not work-related. In the immediate weeks ahead, many employers are going to find themselves facing these and other unintended consequences. I'm hearing from employers on a daily basis about situations that no one could have predicted. I might normally advise an employer to seek a variance from the board by demonstrating that the employer will utilize alternative means to provide equal or superior safety. I might also suggest that an employer seek a memorandum of understanding or a letter of understanding with the division when a particular level of compliance with the ETS cannot be achieved in what ordinarily would be considered a reasonable time. However, those processes take several weeks or months. And as we all know, COVID-19 is a real-time problem requiring immediate action. So an employer facing no ability to fully comply with this regulation, for example, renting a hotel room to quarantine a COVID-19 employee, has no administrative remedy available. Consequently, I'm hoping Cal OSHA and the board can explore creating an expedited process for waiving certain requirements where it's feasible for a specific workplace to comply and the employer can demonstrate other effective means to protect the employee. This would allow employers a path forward for compliance and would also eliminate confusion and inconsistencies in the ETS that are creating the horrible unintended consequences recognized by both Cal OSHA and the board. I thank you again for your time. I look forward to your comments in response to these issues, and I'm open to any questions you may have. Thank you so much.
Thanks for the concrete suggestions. Appreciate it.
Thank you. Okay, on to our next person in the queue. We have Tina Self. Please go ahead, unmute yourself and state your name and the company you're with.
Thank you. My name is Tina Self, and I'm Vice President of Biotech Manufacturing at Bayer's Bay Area Biopharmaceutical Operations, where we manufacture biologic therapies, including an FDA-designated essential medicine. Patients in 50 countries rely on products that we produce at our Bayer facility. Most of these regulations align with our current precautionary measures for our workforce, and in some instances, we've gone beyond these measures, such as our weekly COVID-19 testing program for personnel whose job tasks require them working within 6 feet. However, we believe there are two key elements that require modification in order for operations like ours to continue to remain open and provide needed medicines to patients around the world. First, in general, the regulations should acknowledge the CDC's guidance for worker safety and critical infrastructure operations. A great example of this is the current language in 3205, Section C, 10B, which appears on page 11 of the new regulations. This requires employers shall exclude employees with COVID-19 exposure from the workplace for 14 days after the last known COVID-19 exposure to a COVID-19 case. This quarantine period extends longer than the CDC's current guidance and has been shortened by Governor Newsom's 1214 executive order. Further, the regulation does not acknowledge the CDC's guidance regarding critical infrastructure workers, which allows close contacts, those who have had an exposure, to continue to work with certain precautions in place. I can tell you that if the CDC guidance for critical infrastructure workers is not considered, operations like ours are at risk of shutdown, despite the fact that we have remained free of any on-site transmissions of COVID-19. While Call OSHA is providing the opportunity for an exemption, and we appreciate the responsiveness of staff on this topic thus far, this should be automatic for critical infrastructure operations, particularly those that have demonstrated strong precautionary measures and no local public health authority violations, and have in place regular testing of all on-site workers whose positions require work within a 6-foot radius of others. Second part of the regulation that we would like to be addressed are the testing requirements outlined in the event of an outbreak of minor or major scale at a workplace, which are outlined in sections 3205.1 and 3205.2 on pages 13 to 16. The language in these sections actually is a disincentive to employers who are proactively testing their workforce. If you are proactively testing your workforce, particularly those who are required to work in close proximity to complete their job task, as there is, you will identify individuals who are asymptomatic and positive. We have effectively identified asymptomatic positive cases, conducted contact tracing that confirms they did not become infected through the workplace transmission, and by excluding these workers from the work site while they recover, we are protecting the rest of our workforce. This not only reduces the risk of an on-site outbreak, but also protects the community. However, given the rates of community transmission, if you are testing, you will reach the minor or major outbreak criteria even without on-site transmission. We recommend that the language be modified to exempt companies from further requirements for any enhanced outbreak testing if they, A, provide routine periodic testing of workers whose jobs prevent maintaining the recommended social distancing of 6 feet, offer testing for close contacts of COVID positive cases, and lastly, have no on-site transmissions documented through contact tracing among personnel on site. Thank you for the opportunity to provide our feedback, and we are available should Cal OSHA staff have any questions about our successful COVID-19 precautionary program or about our recommended changes to the regulation.
Thank you, Tina. Your comments about the disincentive are helpful. With respect to the exemption, what we were trying to get at, just for people's information, was this situation where critical infrastructure was using an exemption when they had a need and it wasn't automatic. So if people have recommendations in the future for how we would address that, that would be helpful. We'll also seriously consider your recommendation that we just have an automatic exemption. Thank you.
Okay, next we have in the queue, we have Louis Costa. Louis, please go ahead, unmute your mic and your video and state your name and the company.
Good afternoon. My name is Louis Costa. I'm with Smart Transportation Division. We represent transportation workers in the state of California, freight, rail, passenger rail, bus, and transit. And thank you for the opportunity, and thank you for putting the stakeholder meeting together. I have some concerns specifically with the language in 3205.1. I believe there needs to be more clarity there. We have identified what we believe to be several exposed workplaces, but have gotten some pushback from interpretation of the language of COVID, what a COVID case means in that section, and whether it triggers the required testing. So we believe that there should be some more clarity there, and there are some concerns going forward, because we have some locations that clearly have had more than 3 tests but are not receiving more than 3 cases but are not receiving the required testing. And also we have had members call in and lodge safety complaints, and on some occasions they've been directed to call Fed OSHA. which is concerning. We have had them call back, but there seems to be a deal of discourse there because the properties are railroads. They believe they might fall under Fed OSHA, not Cal OSHA. So we think there should be some guidance put down to the inspectors or to the field offices where it comes to that. So again, I think some language in 3205 should be, some clarifying language would be appreciated and make it easier for us to go forward and deal with the employers on these situations. Thank you for the time. I appreciate it.
Thank you, Mr. Costa. If you could you're welcome to submit kind of written explanation of the scenarios you're talking about that we need to clarify. We don't need to go into them here, but any further information would be helpful.
I submitted some yesterday, as a matter of fact, so I appreciate that. Yes, thank you.
So next we have on the queue, Alex Clifford. Alex, please go ahead, unmute and start your video and tell us the company you're with.
Yes. Can you hear me okay? Okay, yes, thank you. I'm Alex Clifford. I'm the CEO at Santa Cruz Metro in Santa Cruz, California. And I'm going to speak today about what we feel are deficiencies in 3205.1 and 3205.2. I'm going to speak from the perspective of one of what may be few, maybe the only so far, employer that has actually had to try to work their way through your definition of an outbreak. We have had an outbreak here pretty much immediately following November 30th. So I'm going to share some struggles that we have gone through and some concerns that we have. I will tell you we did submit a letter, and we also endorse the California Transit Association letter that was submitted to you. We've had to experience this firsthand, and it's been a nightmare. And I'm going to speak to that a little bit. First and foremost, we request that OSHA immediately withdraw the regulation pending substantial revisions. Metro may be one of the first who've had to try to deal with 32.5. Within a few days of November 30th, we hit 3 COVID positive cases in a 14-day period. Let me just talk about some of the problems. The COVID testing infrastructure is not currently in place to support all of these additional tests that are required. In our case, we employ 300 employees. This one particular work location has 150 employees assigned to it. So the infrastructure is not in place to handle us so-called immediately sending 150 employees through the testing, and then trying to do that weekly thereafter has been an additional struggle, not only for us as an agency, but for our employees. Remember, our employees are bus operators. They're out on the street day in and day out, driving buses and providing a service that is needed for those that are transit dependent and depend on us for essential travel. Many testing facilities also will not allow employees to schedule an appointment unless, one, they have symptoms of COVID, which they don't have when we're sending 150 of them there, or are referred to the facility by a doctor. So out of all of our testing facilities in this county, for example, only 4 of them will allow you to schedule an appointment if you don't have symptoms or you're not referred by a doctor. It's pretty much impossible to meet the so-called, quote, immediate requirement for employers to test the employees, especially since those facilities that will allow us to send employees there for testing when they don't have symptoms, when they're not referred to by a doctor, are booking it at 5 days out. So very hard to meet that immediate requirement. The regulation also doesn't distinguish where the employee contracted COVID. Why is it that a workplace has an outbreak when none of our COVID positives, none of our COVID positives to date have been traceable back to transmission in the workplace? As a matter of fact, to the extent that contact tracing occurred successfully, it was all traced back to things completely unrelated to the workplace. Additionally, why didn't the definition of an outbreak follow Labor Code 3212.88, which used a relative measure for employers with over 100 employees that used the 4%. A relative measure seems to make a lot more sense than treating an employer telling an employer that they have an outbreak when they hit 3, irrespective of whether they have 5 total employees at a work location or 1,000 employees at a work location. It makes no sense. 32, if you're going to do this, 3212.88 would make much more sense. When contact tracing eliminates the workplace, that employee should not be counted in the total count of the definition of an outbreak. Why is it a workplace outbreak if they didn't catch it, it wasn't transmitted in the workplace, and contact tracing proved that they didn't? They shouldn't be counted in the total. Our metro work location has 150 employees. Now, to meet your immediate requirement a week ago, we had to spend $30,000. Let me just say that again. We had to spend $30,000 to find an entity, which ended up being our workplace injury doctors, to come in and perform 150 tests on site. That's exorbitant, that's unreasonable. There has to be a better way, and the better way is, if we're going to do this, you, the state, need to set the infrastructure up in order to be able to handle all of this. Finally, our representatives from the county health agency stated to us that Metro does not have an outbreak, and OSHA got it wrong. OSHA did not follow the CDC epidemiology. And that concludes my remarks.
Thank you, Mr. Clifford. Appreciate that.
Okay, so next we have on the queue, Robert Moutrier. Okay, Robert, yeah, you're on.
Thank you, Kathy. Robert Moutry, California Chamber of Commerce. I will do my best per your request, Doug, and everyone, to be as quick as possible while remaining comprehensible and while getting to the details. As you know, hopefully you know, we submitted a letter with written comments, including all of these changes earlier today, which if my comments move too quickly, the details are there. So our comments center on, and this is broad comments for the entire kind of business community, center on 2 concepts as always: clarity and feasibility. We are not opposed to COVID safety precautions. Turning quickly to the comments themselves, I have 10 specific changes, and I will be quick. In no particular order. The first point, actually not a comment, but Eric, you commented earlier that you will be you have updated often the ETS FAQ on the Cal OSHA website. I've been checking it regularly. I was just going to ask that you could include a date updated, so we, as we watch it, will know if we've caught everything. Turning to the comments. First, the feasibility of testing. These comments have been covered well by Mr. Clifford from Santa Cruz Metro and Helen Cleary from PRR. We would suggest, first, as to large workplaces, Mr. Clifford's concerned that we have an outbreak threshold that is not relative to large workplaces. It is well stated. The only point I would add is that consistency with last year's SB 1159, which would be a 4% trigger in an exposed workplace area, is not just logical, but also allows the consistency. If an employer has to determine, well, this is an outbreak for some purposes, this is an outbreak for another, you're making it that much harder for everyone, but particularly the smaller and mid-sized businesses who will have to comply here. Related to the outbreak trigger, we believe the outbreak conclusion must also reflect the size of the workplace. So for workplaces over 100, we would suggest a percent-based conclusion to the outbreak. Now that could be set at 1% or the percent of prevalence in the community, but something to that effect to reflect the size of the workplace and the potential of social spread. The second solution we would request related to feasibility of testing, and again, the cost and logistical issues, Mr. Clifford stated well, I won't reiterate them. The second feasibility change we would request would be to the FAQ to include some guidance for employers to reflect that if there is feasibility issues specifically regarding testing, regarding procuring it in a timely manner or at cost, that should be addressed in the FAQ. So employers, when they look there, can see, okay, Cal OSHA understands these limitations. We've suggested specific language in our comments. I won't read it here. The second point we'd like to address is we believe vaccinated employees should be considered by the FAQ. Obviously, this is a rapidly developing area, and as federal guidance on these points changes, that may change things here, but we want to flag that issue. We suggest 2 specific provisions to include. Potentially, these are in the exclusion provision, 3502C10, as one example, but I won't read the text we're suggesting there. We briefly suggest a shorter exclusion period if you've been vaccinated. Obviously, that will change over time, so I'll move from there. Next, we would suggest changes to the FAQ to clarify employer and employee rights regarding investigating and contact tracing. As many of you who were on the standards board's call on this regulation over the past couple of months have heard, there have been repeated concerns from employees actually, that when employers ask them follow-up questions, you report, okay, I've tested positive, the employer says, okay, we need to ask you a series of questions about where you've been, who you've spoken to, issues like that. It can be perceived as attacking the individual who reports. Obviously, that's not the case. Employers are forced to contact trace by this regulation. But in order to clarify that and to set employees at ease and also improve contact tracing, we've suggested some additions to the FAQ document to explain employers' obligations there so that it is not upsetting and so that employees will understand the necessity. Third, I'd like to turn to reducing disruption in the workforce. This is particularly apparent in the essential workforce, which is reflected in comments regarding the airlines, I believe by Sophie earlier. But pursuant to the governor's executive order, just recently changing the 14-day duration to a 10 and 7-day, and I know Eric acknowledged that change earlier, we would request that that 7-day duration with a negative test on day 5 be applicable to all essential workforces. I mean, as noted by the airlines here, we have a situation where some of these essential workforces that are not protected are actually providing the vaccine, right? They are shipping the vaccine, they are carrying it, they are providing necessary links in the medical supply chain that relates to these healthcare workers, and therefore a disruption in those workplaces is equally important. The same can obviously be said for agriculture. So we would suggest broadening of that, either via the regulation or potentially in discussion with CDPH, to allow all essential workers and the 13 identified sectors, I believe, that the governor has used for that, to be included there. Again, language in the letter specifically. Next, I'm going to turn to, let's see, make sure I get them all here. Oh, addressing employees who refuse testing. This is a concern specifically regarding the outbreak provisions, 3502.1 and 2 for major and normal outbreaks, I suppose you would call it. In these situations, the employer has to demonstrate that no new cases have occurred for a 14-day period. In that 14-day period, however, if a number of employees refuse testing, right, the employer provides testing, and thank you for the clarification, Eric, regarding providing testing doesn't need, and Doug, clarification need not be in the workplace literally, but merely be paid time. That is much appreciated as a clarification. I've gotten many questions about it. But to the employees who refuse testing, right, after it is provided by the employer, now the employer needs to know whether they can end the outbreak. And that means whether they can cut back on the broad testing requirements of 3502.1 and 2. We would suggest a solution, which hopefully is acceptable in a middle line here, that if an employee refuses testing, the employer can exclude them from the workplace for a set duration, be it 10 or 14 days. And during that time, and we'll discuss the earnings guarantee and the pay issues. I'm sure that's an issue of much questioning that you've received. But during that time, the employee should not be paid subsequent to refusal. Our concern there is if you pay after someone refuses a test, you're actually, in an outbreak scenario, you're incentivizing people to refuse tests. But obviously, there's maybe multiple solutions there. We just believe that we must address how an employer can end an outbreak if an employee in an exposed workplace area refuses testing. Again, specific language to the effect of what I said in the letter. Next, let's see. We believe we need to clarify the guarantee to maintain earnings in 3205C10 related to exclusion. The concern here is that, as we see it, a couple of pieces. First, obviously, the legislature passed COVID-19 specific sick leave, which we believe is soon to be extended federally and thus will continue to affect. The provision does not specifically seem to, is not clear as to whether or not that sick leave is necessary for an employee to be paid, or if we've actually created a continuing sick leave obligation, right? After sick leave is consumed, does this provision create a new need for ongoing earnings guarantee afterward? And that appears to be uncapped. The second issue that I'd like to flag specifically is my understanding of labor law, that an employer cannot compel an employee to utilize sick leave. So while the provision says, I believe that the employer may require that be used, It's not our understanding that that is correct. So we would like that to be clarified. Our suggestion specifically would be that an employer, and this language would be to be inserted in the FAQ to clarify, would be that an employer must, quote, maintain the employee's position, healthcare benefits, and healthcare benefits, and an employee can choose to utilize any accrued paid sick leave, vacation, or paid time off. We would remove the language regarding an employer requiring the employee to exhaust paid sick leave because of our legal concerns on that front, but we're glad to have ongoing discussion about that. Turning to the outbreaks. Oh, yes. The definition of outbreaks, this was touched on by Mr. Clifford as well. The definition of outbreaks under the regulation and the related FAQ does not limit outbreaks to workers only. If workers, and this is troubling for two reasons. One, as an example, if a family of three who do not know they are infected, right, go to a grocery store and go to one other store for shopping purposes, right, in this month, as they might, given that retail and groceries are still open as essential, that family of three would constitute an outbreak, is our concern for purposes of this regulation. And they would constitute an outbreak everywhere they went, regardless of the employer's conduct and regardless of how well protected the workplace was, and regardless, in fact, of whether any employees ever were exposed or became COVID-19 cases. The second reason this is problematic is that it conflicts with the guidance given on AB 685, which was the COVID-19 notice in the workplace bill passed earlier this year. AB 685 guidance, and this is linked to in our letter, provides that an outbreak only occurs amongst workers. So we would ask that the exact same language from AB 685's FAQ, which I have in my letter and I can read to you, be inserted into the FAQ here. The California Department of Public Health defines an outbreak in non-healthcare and non-residential congregate settings as 3 or more laboratory confirmed cases among employees who live in different households within a 2-week period. We would ask that definition be inserted into the FAQ instead. Next, we'd like to request that we think there's a problem with the application of the CCPA, that is California's Consumer Privacy Act, to the data that employers are collecting under the emergency temporary standard. And we would ask that either the FAQ or the text of the regulation be adjusted to specifically exempt the data that employers are required to collect here under one of the existing exemptions under the CCPA, which relates to information collected as related to the work. Again, that text for the FAQ insertion and that citation are in our letter. You already addressed the clarification of working hours point, so I appreciate that and I won't ask it. Putting all of these comments together, the last request for ours is a delay of enforcement until January 15th. The reason we request specifically January 15th is that as this meeting so far has made clear, and I'm sure will continue to make clear, there's a lot of confusion about these provisions. Obviously, you worked very quickly to move this emergency regulation, and there's a lot of urgency, and we absolutely respect and appreciate that work. But given that we anticipate FAQs clarifying and potentially correcting many mistaken interpretations in the coming weeks, and given that this regulation was only made public quite recently and employers are kind of moving quickly, and I should be clear, I've spoken to some of the most well-resourced, multinational companies, and they are having trouble keeping up to the similar extent as the gentleman from Santa Cruz, whose name is eluding me presently, Mr. Clifford, apologies. So we would ask for delay in enforcement till January 15th. Notably, that would not result in a lack of COVID-19 protection because the the pre-existing guidance documents, right, would still be enforceable as they have been cited to previously. So that is the volume of our comments. Thank you for the time, and if there's any follow-up, glad to address it.
Thanks, Rob. We'll be getting out FAQs on some of your pay-related questions as soon as we can, and hope to be getting those out generally at a faster pace. So I appreciate the need to do that, and we'll be continuing to do that.
Thank you.
On my queue, we have Andrew Summer.
Thank you for the opportunity to comment. I am Andrew Summer with Conn-Maciel Carey, speaking on behalf of an employer coalition that has been significantly impacted by the emergency rule like many other employers. I will be brief with my comments. There were a couple provisions I wanted to comment on. Our coalition has already submitted comments in writing to the Standards Board regarding the emergency rule. I am addressing first the definition of exposed workplace in the context of an outbreak and major outbreak. I wanted to echo comments made by Helen Cleary and Rob Mutri concerning the appropriate scope of an exposed workplace and offer some additional context. Wanted to address the definition of exposed work. So the definition of exposed work site is uncertain, and we certainly appreciate the FAQs issued by DOSH providing some clarity on the scope. I think there's a lot more work that can be done on clarifying what an exposed work site is and the various different contexts for that. We also believe that that should be clarified in the rule itself. There needs to be clarity by employers in understanding the scope of an exposed workplace as they attempt to carve up the workplace to determine whether there's an outbreak or a major outbreak and what actions need to be taken. First, a really important consideration is how are employers expected to determine the exposed workplace where there are COVID-19 cases, particularly where the work site is not delineated neatly into these different work areas. For example, where there is a large warehouse space, what is the exposed workplace? It should not be the entire warehouse itself, especially where you have groups within of employees that do not interact. Further, if there are employees, for example, operating powered industrial trucks, merely driving around the warehouse, would that be sufficient for them to be considered in the exposed workplace and subject to that rule? And these are all things that need to be clarified. And we believe that the current measure of applying a numeric figure in determining whether there's an outbreak or major outbreak is just not doable for many of these workplaces, such as these warehouse spaces that I indicated. We believe, consistent with previous comments, that a more appropriate measure would be some percentage of the exposed workplace, similar to what was done with Senate Bill 1159, looking at a percentage of that workplace to determine whether there's a triggering condition there. And in addition, a really important consideration is what is the community spread? What is the percentage of outbreak in the general community versus the workplace that we're dealing with? If it's a lower percentage in the workplace as compared with the general community, surely that would not be considered an outbreak from an epidemiological standpoint. I'd also like to address the outbreak testing component. Currently, the rule reads that testing must be provided to all employees at the exposed workplace. We believe that this subgroup of employees for whom testing is required needs to be clarified and significantly narrowed. COVID-19 requirements for an outbreak or major outbreak are impractical from a logistical perspective given the current surge. It isn't possible to immediately test everyone who may have been present within an exposed workplace and that are not a close contacts given the testing shortages and limited resources. The FAQs and emergency rules should clarify the scope of this requirement. We also believe it does not make sense to require employers to test everyone who is merely present, and the scientific consensus is pointing to direct face-to-face interactions as being the highest likelihood for transmission in this context. And finally, in guidance, OSHA should make clear that employers cannot mandate employees to complete a medical test or require them to receive proof of testing. Simply providing access to testing, encouraging employees to get testing should be sufficient. We need to clarify that employees who decline testing can remain at work so as long as they have not experienced a close contact. We appreciate the opportunity for comment. Thank you.
Thank you, Mr. Summer. We'll address your last point in an FAQ.
Okay, great. So next we have Sarah. Are you ready to go, or do you want us to go to the next person?
Just one more and then I will be ready. Thank you.
Got it. Okay, so next on our queue, we have Holly McDowell. Holly, if you can unmute, turn your video on and state your name and the company you're with. Thank you.
Hello, yes, I'm not going to turn on my video. This will be really quick. I work for a medical device company, and just mirroring what a lot of others had said regarding the major outbreak, I'm just requesting clarification on the 20 cases and whether these are just anyone who enters the workplace, or if this is to really capture work-related spread, or, you know, we have situations where someone's spouse tests positive, so we're certain it's not acquired in the workplace. So that's all I'm asking in this. We're doing a lot of the other things, so the standard overall, I think it's really great. I just am requesting clarification. That's all.
Okay, thank you. We can, we'll try to clarify the both the meaning of the rule in an FAQ and look at how it might be clarified in a future version.
Thank you.
Our intent was to cover COVID-19 present in the workplace, regardless of how it got there, but we are open to recommendations and suggestions on how to fine-tune that or take another approach. So thank you.
Okay, so Sarah, how about now? Are you ready or?
Yes, I am.
All right, Sarah, you're on.
Okay, a little humor first. I was out walking my dog, thinking that I was at least another half hour away from the comments. I'm a little out of breath to get home. Thank you for this opportunity. My name is Sarah Queter, and I am Senior Counsel for Environment, Health, and Safety at the University of California. Okay, as you might be aware, the University of California is a very large university with 10 campuses across the state. And we have over 234,000 employees and over 6,000 buildings. And so from a compliance standpoint, you can imagine this places a large burden on the university. Whew, still catching my breath here to provide to implement the requirements and the regulations. I have two specific comments. One that relates to section 3205C3B3 and the one business day notification. I am aware that this is also required as part of AB 685, but as you can imagine, based on the 234,000 and change employees we have, and then many thousands of buildings, providing a one business day notification to employees who may have had exposure is a very difficult task. And the university is certainly up to that task, but we are interested in whether Cal OSHA can provide some ideas for either how to address large employers. So I know somebody commented about having a building with 150 employees, but maybe some sort of different requirements based on the size of the employer. It might be, it would be helpful to hear what Cal OSHA's perspective on how to handle so many employees and so many buildings and trying to figure out how to comply with the substance of the regulation. Anyway, we are working on that, and we think what we're doing will be compliant, but again, getting Cal OSHA's feedback and input in FAQs or in modified regulations would be great. The next question I have is the only other one, relates to a discrepancy, an apparent discrepancy, at least as to how I read section 3205.1 and 3205.2 related to testing of employees in minor and major outbreaks. In 3205.1b2, it provides that employees in the exposed workplace shall be tested, and then again 1 week later. But that same requirement that puts the onus on the employee to be tested, the employee shall be tested, does not appear in the major outbreak regulation in 3205.2b. There is not a same requirement. It seems to me it would be illogical to mandate that employees be tested in a minor outbreak, but not in a major outbreak. Now, both of them require the employer to offer the testing, but there's not that same requirement that the employee shall be tested. And I know Robert talked about, what do you do if an employee refuses testing? And I think that's a great comment, and I would like that to be addressed as well. But as far as what was Cal OSHA's intent here, is it intentional that employees in major outbreaks just need to be, that the employer just needs to offer testing and the employees shall not be tested? Or was there an intent, was it a mistake, and that employees are required to be tested as well in major outbreaks? And that concludes my comments. Thank you, and sorry again for being so out of breath.
No problem. Thank you. Thank you for your comments. With respect to your last question, I believe that the language for major outbreaks incorporates the requirements for an outbreak as well. I believe there's language at the beginning of that subsection clarifying that, but I could be wrong. Eric can clarify that. And then on the notice provision, those are also related to legislation that will become effective January 1, but we'll take a look at that and try to address it in FAQs and clarify some of the questions you have around those issues. Thank you.
Thank you. I don't see any carryover.
Okay.
From 3205.1 into 3205.2.
Great. We'll take a look at it then. Okay. Thank you.
Thank you.
Okay, next on the queue, we have Mike Donlin. Mike, if you can unmute and turn your video on and state your name and the company. Thank you.
Yes, good afternoon. This is Michael Donlin, representing the Construction Employers Association. And, some of the comments people have made, we definitely agree with, some of the things Helen said and Michael Miller on the continuation of pay issues. We've had the same problems with testing, getting sufficient testing. But our members are some of the larger construction companies, union construction companies in the state, very large construction projects. And those have some very unique challenges with this regulation. Part of it is in 3205.1A and 3205.2A, A and B in both those sections on outbreaks. In both the Senate bills, 685 or Assembly Bill 685 and Senate Bill 1159, outbreaks refer to the employees of an employer, but in the regulation it refers to the workplace. And in a large multi-employer workplace, that causes a lot of confusion on which employer is the controlling employer responsible for this or that, or the employer. And so we have submitted written comments, and we did offer some language to change that to, make it clear that the exposing employer is the one responsible for their employees in many of these cases. So, just the simple thing, by changing place of employment to employer and, whose workplace has been identified as an outbreak, it really would help on these large construction sites. We've had problems with testing infrastructure, availability of tests, trying to get, large scale testing in place, and also the immediate term in the testing. All of those things just don't seem feasible, at least today, to get done. One of the things that we see in here is, in the regulation, it talks about a potential exposure, or potential COVID-19 exposure, but the definition is just for a COVID-19 exposure. And so you're defining what an exposure is, but then throughout their thing, well, there's another place that says treat everyone as if they're positive, and then everything's a potential exposure at that point. So we think in sections 3205 C3, B3, and 4, potential should probably be struck out. COVID exposure explains it. And then on 3205.1 B1 and B2A, it should, right now it talks about all employees at the workplace getting tested, and it really should be limited to all employees that had a COVID exposure. If they were nowhere near, an exposed area, they probably shouldn't need to be tested. And then the twice weekly testing, it's just been a struggle to get any testing. I think this regulation came out, and I think a lot of us employers all of a sudden swamped the testing infrastructure. But it's been a real struggle, and we would like to see that replaced with just weekly testing rather than twice weekly. And then the definition of exposed workplace, it is quite broad. And in a large construction site, you have multiple buildings, multiple floors, different subs are not even interacting with each other. And adding things, and you put this in the FAQs, but FAQs are not the regulation, but, adding things like areas where people momentarily pass without interacting or congregating should really be in the regulation. And also, on a multi-story building, it probably should be limited by floors. So adding the term floors in 3205 B7. And then in 3205 3B2, this requires investigation of COVID cases at all locations where employees may have been. And that's problematic. On a construction site, employees may go different places, but it could just be almost anywhere. And really, it should be based on the contact tracing information that you get from that employee of where they had been. So, Strikeout may have visited and actually get the information from the employee that they stated they visited. Makes it easier on the employer, for one thing, and they can do a better job of it. But it really just, it improves the regulation because you're really focusing on the areas of concern. Another thing is in 3205 C3B5, it talks about investigate whether any workplace condition could have been contributed to the risk of COVID. Again, workplace conditions implicitly include any workplace condition. It's not really needed language, and it actually, any is used quite a bit in this regulation, and I think it's overused as an adjective to kind of make it easier to issue citations to employers that got 90%, 98, 99% of the job right, and something slipped through the cracks. And oh, there's an any, And same thing in 3205 C2D. It talks about all interactions. Well, again, all is implicit in interactions, and it's just a way to, kind of get in there and make it easier to issue citations, even if the employer was really doing their due diligence. So I think that all should be struck. And again, all is used as an adjective throughout this regulation. It doesn't add any clarity, and it's just kind of there. We have several other things. The letter we submitted yesterday is really our top priority issues. We also submitted a letter back on November 18th, I think it was, with more issues. And, we will be happy to contribute to an advisory committee with actual strikeout language that we'd like to see as we come into the committee. And so thank you for your time, and we look forward to working with you on an advisory committee.
Thank you, Mr. Donlin. Yeah, a couple of those are issues that we have flagged in our own review of language. So, appreciate your thoughtful review of the standard. Kathy, who's next?
So next on our queue, we have Kevin Mensky. Kevin, if you can unmute and turn your video on and proceed to give us your name and the company you are with. Thank you.
Thanks, and it's Menke. I'm a Chief Counsel, Labor and Employment at International Paper Company. We're manufacturing, we make paper boxes that move a lot of the essential products including vaccines, and also fluff pulp, which is used in diapers and other, the toilet paper that we ran out of early in the pandemic. I appreciate all the comments, and I'm not going to reiterate, and I've checked off a lot of what I was going to ask. I just need some clarification on what you currently mean. I won't get into what I hope you change it to be. One question on the pay issue, and I think you gave some clarification in the beginning presentation. So I guess the continuation of pay and benefits really is only meant to apply to employees who are not incapacitated or disabled or ill in any way, and that are only those that are essentially asymptomatic and able to otherwise work, but were just a close contact exposure. Just want to make sure that that's the right clarification, so that if they qualify, for example, for company short-term disability benefits because they are incapacitated and disabled from, too ill to work, then we don't have to, and maybe that only pays at 60% as a benefit. We don't have to true it up to the 100% because they're not able to work. I think that's what I heard. I know workers' compensation benefits was mentioned, but I just want to clarify that. And then my second question is, around definition of the COVID-19 exposure, your definitions on the first page says that this definition applies regardless of the use of face coverings. In following the CDC guidance, we as a company, at least outside of California, had come to the conclusion that if our employees wore surgical masks and eye protection, that even if they came within 6 feet of other people for a cumulative 15 minutes in a 24-hour period, that we would not have to count that as a close contact exposure. My question is, and maybe it's just my ignorance of all of your OSHA regs, and that could be, but is there any type of PPE that you would say would prevent a close contact exposure, so that we could try to, more limit, the requirement to test about a lot of people, or to count people as close contacts and put them off work? And that's really the question. Could it be a face shield and a surgical mask? Or is there something else that we could try to put our employees in to eliminate the potential close contact exposure, even if they get within 6 feet? And that's really all I had. I appreciate the time. Thank you.
Thank you. With respect to your second question, under the current language, compliant respiratory protection would qualify as something that would prevent people from being considered a close contact. So fit tested N95 respirator in most cases. As to your first question, it was kind of a multi-pronged question, and some of that's generally right and some of that needs some clarification. So I think it's going to be better for everybody if we put that in writing, and we'll get out one or more FAQs on that. Clarification on exclusion pay next week. So we'll have that out to folks.
Doug, this is Erica Monterosa, and I'm taking over as moderator for Kathy Armas for the next period. Just one moment.
Great, thank you, welcome.
Thank you. Okay, next we have in our queue, Nicole Rice. Nicole, if you could please unmute yourself.
Okay, thank you.
Sure.
I won't state my name or my company yet again, but I just wanted to say that I know that many of the things that I was planning to share have already been presented by folks. So I will raise those to put those on the record for you, but I will also try not to repeat what others have said.
Nicole, sorry to interrupt, but just for our recording, I will ask you just to repeat the name of your company. Thank you.
Okay.
It did not come across.
Okay, sure thing. Nicole Rice, California Manufacturers and Technology Association.
Thank you. Go ahead.
Thank you. I apologize for all the connection problems. So the first thing that I'll raise has to do with the recognition of critical or essential infrastructure industries. I want to align my concerns and interests in this area with those that were expressed by Helen Clearly, I believe her name was, and Tina Self from Bayer, that we too, there are, as a manufacturing industry, there are many manufacturers who have been open since the original shutdown here in California and have been operating with great success under the guidelines that have been coming from CDC and federal OSHA related to critical infrastructure industries. That's not a new concept that came as a result of COVID. That is something that has existed for some time. So there has been a lot of thought and consideration to what those industries are, how they continue to operate in emergency situations, and over the last 9 or 10 months, fine-tuning those aspects related to this particular health pandemic. So to the extent that this regulation could recognize that, as other federal documents, and I would say to some extent the California Department of Public Health has done already, so that where critical infrastructure industries are compliant with definitions and guidelines that are under CDC, and those protections are providing, or I'm sorry, that guidance is providing protection that's equivalent to or greater than the protection that's in this regulation, that they would be deemed compliant. That is similar to language that was submitted in the Virginia Emergency Temporary Standard. I have a link that we will include in written comments later today that shares that language, and that could be included to provide accommodation for those types of industries. Secondly, it was brought up by the Philmar Regulatory Roundtable about a shortened quarantine time for all critical infrastructure industries and their workforce. We would agree with that comment. Now that the CDC has reduced the quarantine time to 10 days instead of 14, we would urge Cal OSHA and suggest that language needs to be included in the regulation that now allows for a 7-day quarantine time for those workers that are asymptomatic and can return to work with the heightened screening, testing, and contact tracing requirements that can be provided by the employer. Secondly, and also to this comment, I believe in section 3205C11E, there is what appears to be a nod maybe to essential workers or to critical infrastructure industry, but it's not direct or plain. So if that section represents an intent by Cal OSHA staff to try to recognize the existence of critical infrastructure industries and try to provide some opportunity for them regarding flexibility under the standard, I would just suggest that more plain language needs to be used. And again, the Virginia standard is a place to look. Also, just referencing back to CDC related to those industry sectors would also be another alternative. Secondly, we would suggest that because we have seen already with the changes, scientific-based changes that were made at CDC that reduced the quarantine time from 14 days to 10 days for certain workers who have been close contact but asymptomatic, that definitely highlights a need that we have raised before to make sure that this regulation can be flexible and adapt when those scientific-based changes are made in this evolving pandemic and crisis situation. So we would suggest that staff consider the inclusion of language that would allow for an automatic adaptability of this regulation. So again, as one caller said, you would not have to rely on an executive order or another revision or anything like that. But for those particular sections that would apply to whatever has been revised, that the regulation would automatically do that on its own. Secondly, we agree with several of the comments that have been made regarding the exposed workplace definition. We definitely think that that needs to be addressed. There's been several things that have been said here about the intent behind that definition, but again, as long as it is not in language, it raises questions and concerns from the employer and specifically the manufacturing community that adds to the lack of clarity in this standard. Specifically, staff has included in the FAQ an explanation of what an exposed workplace is to be only the areas of the building where COVID-19 cases are present during the high-risk exposure period. That is a much clearer statement that, if incorporated into the regulation itself, would help tremendously with understanding what those areas are. So we would recommend that if that is where staff definition lands and feels confident enough to put that in the FAQs, that language should be interpreted and included into the standard itself. As one caller just said, FAQs are just that, but it's not the language of the standard. Let's see. Trying to cut my comments down here. Confidentiality. So several callers have made suggestions that there needs to be clarity for a variety of different aspects of intent behind language used, and also providing guidance to employers. I would suggest that FAQ guidance on how employers are to maintain confidentiality when they're providing COVID-19 exposure notices to those employees, that those would be helpful. Answering the question about the applicability of HIPAA to those situations, best practices for delivering that notice and things of that nature would be very helpful and address concerns and clarity issues. Let's see here, just scrolling down, not to be repetitive. As it relates to the section on outbreaks, section 3205.1 and 3205.2, again, I align my comments with those that have been made by other participants about a better trigger for what an outbreak is. Certainly looking at SB 1159, and aligning for larger employers to a percentage of their workforce, or even just a general percentage, is definitely needed. I have heard from several of my larger manufacturers that 3 individuals would trigger this just constant serial outbreak scenario. That would be very costly, and I would submit would not help in trying to get actual real data that's effective. To the comment that was made by regarding local jurisdictions and how they're viewing what an outbreak is, I have heard several comments from my membership related to their relationships and communication with local jurisdictions. So alternatively to a percentage that would be included in the language, you could just eliminate the number in general and allow local jurisdictions to make that determination. The local jurisdictions know better about their local transmission rates, their infection rates. They're doing their own contact tracing. They're also very familiar with their local economies and many times the companies that make up those economies. So therefore, they would know best what would constitute an outbreak, and that could alleviate a lot of the concern and angst. Again, with the testing, I align my comments with many of those that have been made about the testing, the need for clarity. When you get clarity on exposed workplace, then you get clarity on the testing. One point that I did want to make about the availability. So I am hearing from my companies, specifically larger manufacturers, that they are trying to be proactive and secure third-party vendors. And they are hearing that demand is high with this regulation, with the surge that we're experiencing. They're talking about limited staff and resources, the concern about exposing their own employees. If you have a workplace outbreak situation, sending their employees to the site to try to accomplish those tests, it can be very costly to them as well, these third-party vendors, to try to handle big facilities with thousands of employees. They've got limited equipment and supplies and materials, and staffing availability is difficult. So this is coming from the third-party vendors who we could either contract with or have come to our sites to conduct these tests. But in addition, the local government or public health agency run clinics are also inundated and oversubscribed with individuals interested in getting tests. And they too are saying, don't send your large number of employees to these clinics because they need to prioritize for a variety of reasons. So that just adds some information for staff to the feasibility of trying to do these tests, especially, as one caller pointed out, with this immediate testing that's required when you have 3 or more who have tested positive or been exposed. So the feasibility of those requirements is very, very difficult.
Ms. Rice, I'm going to ask that you draw your comments to a close so that we can give other people an opportunity to comment or ask questions. Thank you.
Thank you. I appreciate that. And I was just headed there. I am all out of highlights on my Word document. So we will be submitting more detailed comments in writing, but I thank you again for this opportunity.
Thank you very much. I appreciate it. Erica, who do we have next?
Next in the queue, we have Talia Delanoy. Talia?
Yes, thank you. I also have some requests for clarity on the standards, and I will try not to overlap. My name is Talia Delanoy. I'm an attorney with Gordon and Reese, and I represent numerous employers throughout the state of California. I'd ask that and I realize there's been a lot of debate and requests for clarity on the exclusion pay requirement, and so I just want to double check that I can request clarity on the definition of public sources and any other means of exhausting paid leave prior to the employer being required to provide exclusion pay. I heard some comments on this earlier, but would like clarity on whether employers are required to top off other non-employee sources of pay, such that the employee would be receiving 100% of pay while out of work. So that would be my request as it relates to 3205C10. Also, with regard to the notice to the employee requirement, whether the standards of the FAQ could clarify whether the information on the benefits available to employees excluded from work is meant to be specific to that individual employee. For example, the notice must say, you, Jane Smith, have 10 hours left of EPSL funds under the FFCRA, or you have 40 hours remaining under California's supplemental paid sick leave law, or whether it's sufficient for an employer to simply identify the various paid sick leave laws that apply to them, and also to indicate whether there might be other benefits such as disability, paid family leave, or California paid sick leave. Another request is that we clarify the directive that I believe I heard earlier in the opening comments, that employees must be able and available to work in order to trigger exclusion pay, and that the FAQ or some publicly available document confirm the statement that I heard earlier that if an employee is sick and thus unable to work, that exclusion pay is not required. Lastly, I request that clarity on situations in which employees are working at work sites that are controlled by other entities. So if an employee is in a building that, for example, their employer has no control over the ventilation system or other engineering controls that are required by the ETS, that the guidance indicate that the employer may defer to the owner or operator of the building or work site in which their employees are working, and rely on that owner or operator to comply with the ETS in its own right. So those conclude my requests for clarity. Thank you.
Okay, thank you. Yeah, we will be putting out an FAQ that it will state that if an employee is too sick to work, they're not eligible for exclusion pay. They're not because they're not able. There are other scenarios that we're going to have to address in those as well, but that basic principle is correct. And we'll address the other questions that you had as well. Thank you.
Okay, let's see. Just a reminder to everyone, please do keep your comments and proposals brief. And I just want to remind everyone that you can also submit proposals to R as in Robert, S as in Sam, at D as in David, IR.ca.gov. I also want to remind everyone we are recording this event. We will make the recording available on our website so that you can access it. And with that, next person in our queue is Judith Nydorf. Judith, please go ahead.
Thank you very much. I will be brief, and I apologize for not having video. I had two comments that I wanted to make. The first is in relation to 3205, Part C, Section B, Item 3, which is where they, I'm sorry?
I'm not sure why others are unmuting themselves. Just one moment while I fix that, Judith.
Okay.
And Judith, please go ahead.
All right, thank you. So the first is 3205 CB3, which is in regards to notification having to go out for 1 business day across the work site. I was wondering if it would be possible to add a definition of business days to the definitions earlier in that section, or to change the wording to clarify as to whether Cal OSHA is indicating a business day as Monday through Friday, or a business day as the day that the largest shift is in, or a business day as any time that the business is operating, because I'm sure my business isn't alone in the fact that it's 24/7, but we do have majority day shift during the weekdays, and it's just a skeleton crew for the nights and weekends. And I would just like there to be clarity as to whether those count as business days as well. And my second comment is in regard to Section 3205.3, the housing requirements. And this is more of a general comment, which is that the way that it's written, it seems to be unenforceable without violating employee privacy. So employer provided housing is defined in this section as anything including the employer renting a house to an employee, or the employer providing land for the employee to park a mobile camper on. In those cases, the interior of the house, the interior of the mobile camper is the employee's private area. It's not a work-controlled area. So I'm unsure how the employer would be able to enforce the spacing of beds and furniture, the wearing of face coverings, the social distancing within the location, and the daily cleaning and dishwashing that are specified within that section. Thank you.
Thanks very much for those comments.
Next in the queue is Maria Tapia Hernandez. Ms. Hernandez, go ahead.
Okay. Good afternoon, everyone. I hope you can all hear me. Thank you for this opportunity to speak. I think I probably will be making the first comment from a little bit of a different perspective. So just for background, my name is Maria Tapia Hernandez. I'm an attorney at Legal Aid at Work, a California-based nonprofit legal services organization. Through our clinics and helplines, direct representation, and policy advocacy, we enforce compliance with and seek to expand existing workplace protections. We hear directly from low-wage workers every day who are struggling to keep their jobs and income while caring for themselves and ill family members. During this current pandemic, we have seen a request for assistance significantly increase. Just between March and October, we had 3,000 calls and conducted over 130 virtual clinics statewide addressing workplace issues. Every day, we know that workers are being forced to choose between going to work sick or losing their job and income. We all know this is dangerous, and it's dangerous for the workforce, and it's dangerous for the community. So we have a few comments we want to make regarding some of these standards. To begin, we want to look at section 3205B7A. We're looking at definitions of exposed workplace. We believe that this should be amended. It is currently written in a way to exclude employer locations that a qualified individual did not enter. However, in a multi-work site situation, which is something that several people brought up, it would be difficult for an employer to know with certainty and to know quickly enough that the qualified individual did not enter these locations. It is not uncommon for employees in areas such as landscaping, building maintenance, and construction, as was mentioned before, to be sent to other work sites and other buildings, often on short notice and on a temporary basis. These standards, we believe, should not be written in a way that limits information sharing, that would protect workplaces and ensure worker safety. As currently written, this could allow an employer to delay notifying employees at a second work site with overlapping staff. Moving on to section 3205C10C, looking at the exceptions. We believe exception 1 is not clear enough, and it should be clarified to indicate that a worker who is disabled by COVID-19 is not excluded. And then moving on to exception 2 in the same section, 3205C10C, we believe that this actually should be deleted. COVID-19 caught at a second job or outside of work is no less contagious and no less dangerous to a workplace. And if workers are unable to know that their job is safe and receive pay, they will more than likely go to work and continue to spread the virus. Thank you for the time to speak.
Thank you very much. Erica, who's next?
Thank you. Hey, just a reminder, if you would like to speak, we do need for you to raise your hand. We are really not looking at the chat as the queue for requests for speakers. So having said...
Erica, there may be a few folks who don't have that feature. I, for one, don't have a hand-raising feature, and I think a few people have made that comment in the chat, so we may need to maybe kind of redo, I don't know what the best way to deal with it is.
Okay, well then...
I'm sorry, Erica, this is Kathy. So I have been looking at the chat, Mike and Susan and I, and if anyone has specified that they did not have the raised hand feature but wanted to address or make a comment, and they can type it in and we can read it out for them. So we've been looking for those. I just want to let you know.
Thank you, Kathy. And having said that, I believe Jen Hamlin, if you're ready, we'll go ahead and have you speak next.
There we go. Thank you. It was not letting me unmute.
Yeah, that was on my end. Sorry. Go right ahead.
That's okay. I appreciate the mute while everybody else is talking. Thank you for having me here, and I'm happy to be here, not at the 9th hour like the last time I got to see you all, so I appreciate your time. My name is Jen Hamlin. I'm with Public Risk Innovation Solutions and Management. We're a public agency, JPA, for counties, cities, schools, and special districts throughout the state that provide critical and essential services to the public. I think most people have addressed a lot of our questions. Rob, I think, hit almost all of them. So I thought I would just highlight a few extra ones that we would like some clarity on, in addition to a letter that we'll be submitting. So specific to testing, where you refer to the employer providing testing, we would like some clarity in the language that the intent is not for testing to be provided by the employer or on the employer premises, rather directing them to a local testing facility. As well as you kind of clarified this earlier with the intent of the employees to be paid for time spent obtaining testing, but maybe some clarity that it's to be done during work hours and not necessarily at the employee's convenience that might incur overtime. So we request some clarity on that. Additionally, if we could get some clarity on other engineering controls and PPE specific to sharing of vehicles and high touch points, and more specifically for police vehicles and fire trucks, where often you might have multiple people within the vehicle and a shift change. What is acceptable for cleaning of the vehicles? Can disinfecting wipes be done? Is there a duration? Because obviously you can't have the same type of thorough cleaning process that you might have in an office setting, or the duration in between. And also just clarifying that employees can be the person responsible for cleaning their workspace, whether it's the partition in between cubicles, that some of that can be done and have some employee responsibility for that cleaning as well, as long as the employer provides the necessary equipment to do so. And then we would like some clarity as far as exclusion of employees from the workplace, or I should say COVID cases from the workplace. Under 3205, under C10, where the employer, where it speaks about they shall maintain their earnings, just clarifying that the intent, again, is not for the employer to provide full salary continuation when no leaves are available or they've all already been exhausted. I know a few others have asked that question as well. So if they've already used all their COVID-specific leave or have no sick leave available, that the intent is not for the employer to continue their full salary during that entire time. And then just a few highlight things. We would request that you also provide some clarity on the isolation and quarantine periods for healthcare workers and first responders that are asymptomatic, in conjunction or align it with the governor's executive order N-27-20 that provides for them to continue working if they're asymptomatic and not necessarily isolate due to the need. Can't have the entire healthcare industry and first responders go out all at one time if they're asymptomatic. And then just have some consideration or provide some guidance on the additional costs and funding for some of these measures that need to be implemented for public agencies and local governments specifically. We're funded directly from taxpayer dollars and can't simply raise taxpayer taxes to the public. It's different than raising consumer prices, but we don't have additional funds within the current budgets in order to pay for some of these additional measures. So we would appreciate some consideration for that. And then finally, as you go through and look at additional provisions or clarity, to look at also the state's contact tracing and the data that's been finding that the primary causes and spread of the virus is from non-workplace exposures. And I know, Doug, you said you were going to be providing some more clarity for that. But I think it would be helpful to really take the data into consideration when updating or implementing employer responsibilities and requirements, especially when it comes to exclusion from the workplace. So we will be submitting a letter to you as well with more thorough details and questions and suggestions. And I thank you for the opportunity today.
Okay, thanks very much.
Thank you. Our next speaker is Katie Hansen. Katie, please go ahead.
Good afternoon. I'm Katie Hansen with the California Restaurant Association. Thank you for today's opportunity to provide restaurant-specific feedback on the ETS. Our first comment is with regards to testing. Testing obligations in the proposed rule should be revised. Compliance with the testing obligations would be a serious challenge in the restaurant industry and would impose an unreasonable financial burden on restaurants. It is unfeasible for a restaurant to obtain individual testing kits to test employees on site at work. Restaurants have been financially devastated due to the government-ordered shutdowns and do not have the ability to pay for individual COVID-19 tests. The magnitude of costs to a restaurant to purchase the necessary tests to comply with ETS in the event of an outbreak are enormous. The standard completely ignores the reality of massive demand for tests and the very real possibility that there simply will not be enough tests in the marketplace to comply with this regulation, both of which will lengthen turnaround time. Additionally, the employer testing requirements gives us cause for concern as neither our members or their workforce are trained healthcare professionals. Tests should be administered by trained healthcare professionals and California Baseline, which offers free testing services to all Californians. The testing requirement also gives rise to several questions for restaurants, such as, are we required to test employees who have already tested positive within the last 90 days? How are we supposed to handle employees who refuse to test during outbreaks? Additional clarification is needed for restaurants with regards to these questions. Next item, fixed work locations. In section 3205 C8A, engineering controls requiring restaurants to install partitions in fixed work locations like a restaurant kitchen where it is not possible to maintain physical distancing due to the nature of food preparation are completely infeasible. Just imagine plexiglass melting on a hot industrial surface. Restaurant kitchens have hot surfaces, a variety of appliances and preparation spaces. It is not feasible to partition off parts of the kitchen. This section in the regulation needs to be revised to take into account the unique nature of an industrial kitchen. Administrative controls such as wearing PPE and cleaning sanitizing measures should be used as an alternative control measure to control the spread of COVID-19 in fixed work locations if engineering controls are not feasible. Finally, with regard to exclusion and compensation, Section 3205 C10, B, and C are unfeasible for restaurants and restaurant employees. This section is a one-size-fits-all approach that does not work for the restaurant industry. It is not possible for servers, bartenders, chefs, and cooks to telework from home. Restaurants and their employees have been financially impacted from COVID-19 due to restaurant closures, dining room closures, and the loss of customers. Excluding a restaurant employee who has been exposed to COVID-19 and tested negative for the virus from work for 10 days denies the employee of the opportunity to increase their earnings and could easily close a restaurant entirely for 10 days, resulting in economic loss to the employee and the business. All of the food costs that a restaurant had spent to provide food for its customers would be lost, adding another financial burden to a restaurant in that 10-day period if they were to close. Requiring restaurants who have been financially devastated due to COVID-19 to continue to pay an employee who is excluded from the workplace and has exhausted their paid sick leave will create an impossible financial burden at a time when restaurants are barely hanging on due to the financial or due to the state shuttering them by order. Additionally, the unlimited time off required by the standard will result in the inability to staff a restaurant to be able to open, resulting in the unworkable situation where we are now paying all of the team members and the restaurant is not even open or generating sales. These issues raised are of critical concern to the statewide restaurant community and warrant thoughtful focus for the longer term and require a full formal rulemaking process. Immediate focus for clarification and development of something that is workable for restaurants in today's ever-changing context is most needed. Thank you for the opportunity to comment today.
Thank you, Ms. Hansen. Erica, who's next?
Next we have Steve McCarthy. Mr. McCarthy, go ahead.
Thank you very much. I'm Steve McCarthy on behalf of the California Retailers Association. At the risk of being too repetitive with other employer groups and what's been said already, I'll just talk about a couple items of particular importance to retail. First of all, on the exposed workplace definition, I want to say we appreciate the work that's been done already on this issue in the FAQs, and we look forward to further clarifications, particularly as it regards making distinctions between shifts, people operating at different times in the same workplace. With regard to the limiting of the outbreak definition to employees, we'd concur with the comments made by Mr. Motri and others. This is a particularly problematic issue for retail when you have vendors and customers who could still be counted when determining the threshold for an outbreak. In addition to being inconsistent with the AB 685 guidance, we also are hearing that this is not the approach that local health departments are currently using. So I think that's a particular area where we'd like to see amendment to the regulation. On others of these, there could be amendments or perhaps guidance clarification. The issue of testing shortages has already been mentioned. Our employers are already testing into the thousands of employees under this provision, and we are hearing that there are shortages, difficulties in acquiring tests, and costs are going up rapidly. So we'd like to get clarification on what employer responsibilities are when there is a shortage, and if there is some safe harbor that perhaps can be offered, we'd be happy to work with you and your staff on that issue. Likewise, employee testing refusals of employees to test or to provide test results to employers. Mr. Motri covered that very well, and we'd concur with his comments. Finally, with regard to the outbreak threshold issue, the 3 cases in 14 days, even with the improved definition of exposed workplace, we're still hearing about this from a number of our companies, that this is that there are still concerns with the larger workspaces. We would be open to either changing this threshold to reflect what is in current law under the new workers' comp law, or per Ms. Rice's suggestion earlier, perhaps relying on the local health departments. This is, we understand, a practice in Oregon, and we'd be happy to share language with you on that front. That's all I have. Thank you very much for your time, Director Parker, Mr. Berg, and everyone on staff. Thank you.
Thanks very much. I would appreciate any specific information you have on difficulty that your constituents have in getting, or members have in getting tested, or obtaining testing resources, and that goes for anyone on the call. That's something that we are want to make sure we have a clear handle on, not only as we consider amendments to the rule, but just knowing that now in terms of how we conduct our enforcement practices. So any information that we can get from stakeholders on unavailability of testing or delays in obtaining testing, we'd appreciate that information. Or if people are not having issues getting testing. And those can be sent to the same email that Eric provided earlier, rs@dir.ca.gov. Thanks again.
Next in the queue, we have Bill Benham. Mr. Benham, go ahead.
Yes, hello, thank you. So I want to address 3205 C8E2 and ask for clarification and direction on how to comply with this section. So 3205 C8E2 states that employers shall evaluate the need for respiratory protection in accordance with section 5144 when the physical distancing requirements in subsection C6 are not feasible or not maintained. So my question is, or comment is, how does the employer evaluate for the need for respiratory protection without performing monitoring? And I would suggest striking 3205 C8E2 because C8, 1, 3, and 4 may be sufficient enough to guide the employers on when and where and what PPE to choose. So 3205 C7 requires persons to wear face protections if they're within 6 feet. And then C8E2 asks employers to evaluate the need for respiratory protection. So I'm wondering which is it? And that's my comment. Thank you.
Thank you. I think I can answer that, but I want to consult with Eric first and put that in an FAQ. So we'll be trying to answer that as soon as we can next week. Thank you.
All right, we're going to move on to the next person in line. Ken Smith, please go ahead.
Yes, thank you very much. I had a couple of comments that we'd like to put on. I'm Ken Smith. I'm with the University of California and serve as their executive director for environmental health and safety. The first one is in regards to, I think, the popular section here, which is 10C that talks about the exclusion of employees either when they have been in close contact, they're an exposed individual, or they've been diagnosed as being COVID positive, a COVID case. And in that section here, it had talked about kind of the protection and the preservation, as Eric had said, the preservation of pay and benefits. And I think one of the challenges that we're having is understanding the last sentence in subparagraph 10C that adds kind of an exclusion to it. And I'll just read it. It says, quote, "and when not covered by workers' compensation." The challenge of this is, as I understand it, occurs when a person who is exposed, this close contact that we are excluding from the work site because they potentially may be incubating the virus, and we need to exclude them or quarantine them from the workplace. In those cases, we understand that we have to continue to pay full pay to those individuals even when their leave is exhausted, but we can require them to use sick leave or other paid administrative leave that we're providing them. But for the individuals that test positive, this poses kind of an interesting quandary because those individuals that are positive with the virus are eligible for workers' comp, right? Having a positive test and a work-related exposure meets the minimum threshold criteria to file a workers' comp claim and have that accepted. In those cases, though, those individuals that may be positive either may be healthy, they're asymptomatic carriers of the virus, or they may actually be sick and have symptoms and be unable to work because they're not feeling well. The challenges, of course, is what does the standard mean? Does it mean that we are to continue to pay them their full salary and benefits if they're asymptomatic? Or perhaps, as was suggested earlier, if they are sick and not feeling well and otherwise not able to work, can we reduce their pay? As you may know, that most worker comp insurance only covers about 2/3 of an employee's pay when they're on workers' comp. So that is one item that we'd appreciate clarification from the division here in their FAQs. The second item, if I turn to, is back in the definition section under subparagraph B here, or paragraph B, is the definition of a COVID exposure. We understand that is having a total cumulative exposure of 15 minutes of a COVID positive individual within 6 feet. But certainly because of the prevalence of the virus right now, it's possible that employees may have of fractionated exposure, perhaps 10 minutes exposure to one COVID case in the morning, and then another 10 minutes of close contact exposure to a second COVID case within that same day in the afternoon. And there's been a lot of confusion about if they meant to just say 15 minutes up against one particular COVID positive individual, or if you had two 10-minute exposures against two different individuals. Does that equal, again, 15 minutes total exposure within that same workday? So if there could be some clarification on there. The third thing I'll just mention is in one of the latter sections, 3205.3H1. I mentioned this in the standards board meeting, but perhaps clarifying this in the FAQ might also be important. They talked about isolation of individuals with COVID exposure, and just to keep the terminology in line with public health terms, we use the term isolation to refer when we are excluding an individual because they are actually positive to the virus. They indeed are incubating the virus and shedding the virus, and so we're asking them to be excluded from a place because they are infected and they may be spreading the virus. And we use the term quarantine for when an individual is being asked to be excluded from a place because they might be incubating the virus, but may not be shedding it yet. We gotta let, just kind of like the alien in Aliens, we gotta let the virus grow a little bit before it can shed and erupt from their body, and we can detect it in a test about 5 days after their exposure. And then last but not least, just I guess perhaps a question or a point that if Cal OSHA hasn't thought about this is certainly respecting the comments that were provided earlier about the need to actually adjust the regulation versus just providing guidance in the FAQ. It does kind of create kind of a catch-22 situation where, as I understand it, if Cal OSHA were to approach the standards board with a new revision to the emergency temporary standard, that would alter the clock cycle. As I understand it, this ETS is in force or is eligible to be in place all the way through October of 2021. But if you touch it and revise it, it starts one of the shorter 90-day periods. And to get us through the remainder of this pandemic, we certainly are going to need some regulation in throughout the most part of 2021. So that may be one thing for Cal OSHA to consider a little bit as it moves forward in this process. That concludes my comments. Thank you.
Great, thanks very much. And we will be we'll be addressing the specific question on workers' compensation next week. I want to make sure we have the correct interpretation. And thank you for your other questions. Those are I don't know that I've heard some of those, so we'll be sure to include those as well.
Okay, thank you. I do want to let folks know we've got several people still in queue. The next 4 people in queue, just for your information, include James Sandoval, Bruce Wick, Carlos Agüeda, and Michael Pimentel. So having said that, Mr. Sandoval, please proceed.
Hi, hello. So I'm here to, well, James Sandoval, I'm a union representative, general chairperson for Smart Transportation Local 23, and I'm also a bus operator for Santa Cruz Metropolitan Transit District. And I'm here to try to get some clarification and also offer the perspective of the employees trying to get this done as well. We were caught a little flat-footed with this new regulation here at Santa Cruz Metro, and we first had on-site testing to make sure that this gets done. And that was sort of a clean process, but we had to squeeze every single employee here within a small fraction of a window to get tested on site. And now we're tasked to try to get our tests done somewhere else. And the obstacles that we face getting the test somewhere else is there's only a few places that offer the testings with no questions asked. And those are filling up rather quickly, some around exactly 6 to 7 days out from when you get tested. And and if you try to go anywhere else, like your own doctor, they make a mandatory appointment with your doctor first before you even see if you qualify to get tested. They're making it very difficult for us to get tested. They say if we're not exhibiting symptoms or if we haven't been in direct contact with somebody confirmed to have COVID, that we don't qualify. So we're running into obstacles all over the place trying to get this done outside of on-site testing. And with this first round of us getting our test outside somewhere else, most of the drivers did get their appointments outside on their own time. They were able to squeeze it in this week. It was very difficult for us, and most of us got it done, and some of us during our working schedule. And when we didn't exactly get 7 days out, so that's another clarification that we want, because it's very difficult to get exactly 7 days out from when you got your first test. And I don't know how much their flexibility is as far as 8, 9, 10 days, but it's very difficult to get exactly 7 days, especially with holidays around the corner like Christmas. Places are closed. You can't get your test done. And then the other obstacle is if we don't do it outside of our own working schedules. We got operators here, bus drivers, that don't know their schedule until the day before. So they don't know their schedule until the day before. So to book an appointment a week ago to know what time they're working is going to be rather difficult. And they range from really early in the morning to late at night, so that's going to be very difficult. And if we do have every single operator here schedule their appointment during working hours, it's going to detriment our service dramatically. We're going to have operators getting relieved left and right, and I don't even know if we have enough relief vehicles to make sure that everybody gets tested during their working time. So that's another concern that we have. And if we are to get our tests done outside of our hours, right now we're getting 1 hour of pay. I don't know if that's, suffices to get paid during our working hours. So I need some clarification as to whether, if we do get our appointment outside of our hours, 1 hour of overtime or some like fixed amount is okay, or did they have to get paid from the time they travel from their home to the testing site and back, and, stuff like that. And also I did look at the Q&As as far as, the exposed workplace. It's a little contradicting as far as like what an exposed workplace consists of. It does say that an exposed workplace could be walkway, hallways, and aisles, but then it says when determining which areas constitute a single exposed workplace, it says you don't have to consider places that you pass through without really interacting or congregating as as a place that's exposed. So that's what we're trying to figure out here at Metro, Santa Cruz Metro, whether we're required to do this, because all of our operators clock in and out at the same building. We don't necessarily we share the same break room, but we have no idea when they've been in there, who's been in where. We got multiple levels in this building. Did we include all levels of the building, because they do come in momentarily, so it's rather confusing to figure out if we're in exactly an exposed workplace. So yeah, I guess clarification to those issues would be great, and as soon as possible, because we're currently getting our tests now and trying to get these requirements done. So thank you for your time.
Thanks, Mr. Sandoval. Some of that we can address in FAQ. Some of that is site specific, and we may have to connect you with one of our staff to get a little more information, and we can do that. So, yeah.
Okay, so it's almost 3 o'clock, and we are going to call for a 10-minute break. My clock reads 2:59, so why don't we rejoin, and Mr. Wick, you will be the first speaker at 3:10. So we will take a pause now. Thank you.
Great, thanks, Erica. Appreciate it. Look forward to the advisory committee. I won't repeat other comments. My name is Bruce Wick with CalPASC, Specialty Contractor Association. I just want to make 2 comments. One is on item 3205 C3B3, the notice requirements. A lot of employers are now considering within 1 business day, they have to do the investigation. They have to figure out who was potentially exposed. And many are, as AB 685 is coming, saying, I have to get out 2 different sets of notices, when we want them focused on identifying the parties to offer, testing and consider, exclusion. So one thing we might be able to consider is compliance with AB 685 notice, compliance with C3B3 notice requirements here. The second part is, as we've already said, item 3205C6, the physical distancing is really out of place. It should be part of the engineering controls. So many smaller employers are not familiar really with the hierarchy of controls, and it would be really nice if we could put that in the right order, and again, focus on feasibility. You've heard from many the problems that just, demanding a partition in many instances does not work, and that's part of the engineering analysis and feasibility. So those would be two really helpful things to fix as we go forward. Thank you.
Thank you, Bruce. Appreciate that. And we'll be addressing that, the 685 issue. So that I think we'll be addressing your concerns.
Okay,
Erica?
and yes, thank you. Just as a notification, the next 5 people that we have in queue so that you are ready include Carlos Agueda, Michael Pimentel, Tricia at Ad Council, Daniel Nagel, and Vince Hundley. We do have many more people waiting to speak, so just a reminder, please, to keep your comments brief. And with that, Mr. Agueda, please go ahead.
Good afternoon. Carlos Agueda with Turlock Irrigation District. My comments were more towards what is defined as a room. Is it something with 4 walls and a ceiling? That would come into question whether it meets the criteria of an indoor facility. We could have somebody that's in a 12,000 square foot warehouse on opposite ends. They would still be required to wear masks. So that's all I had.
Thank you. We will try to address that. Our standard currently reflects the face covering guidance that's been issued statewide by the state health officer. So we'll try to address that in consultation with them.
Thank you, Mr. Agueda. Michael Pimentel, please go ahead.
All right. Well, thank you so much for the opportunity, folks. I'm Michael Pimentel, Deputy Executive Director of the California Transit Association, representing 85 transit and rail agencies throughout California. I just want to begin my comments today by stating clearly that the concerns we're raising today, and which are detailed for you in full in our comment letter filed prior to this meeting, don't necessarily reflect disagreement with the intent of the ETS or its focus on worker protections, something that all of my members take incredibly seriously, but rather with various aspects regarding implementation. So in particular, we're concerned that the testing requirements in the ETS cannot be delivered within existing budget and operational capacities for transit agencies, within the existing agreements already in place between transit agencies and their testing facilities, or even through the existing healthcare system, given its capacity constraints, but also its requirements for accessing tests that in some cases are far more stringent than what the ETS assumes. And several other speakers have spoken to this latter point. Now, the state can help in this regard by requiring the healthcare system to honor all testing requests filed pursuant to the ETS by providing priority access to testing to employers that employ essential workers, and by identifying new financial resources for employers to ultimately meet these requirements. Separate from these testing requirements, the ETS, as amended by the governor's executive order, requires employees with COVID-19 exposure to be excluded from the workplace for 10 days, even if they are not exhibiting symptoms. This may have significant impact on the ability for transit agencies to maintain service, which today primarily supports the travel of essential workers and the travel of individuals without access to personal automobiles. As such, we believe the ETS should be amended to eliminate this requirement for employees working in critical industries that are not exhibiting symptoms, given the significant workforce capacity constraints and the essentialism of the services that we provide. Now, recognizing the cost impacts and capacity constraints I just noted, but also very clearly limitations on the ability of employers to dictate the health decisions of their employees, transit agencies have raised concerns about the lack of differentiation of requirements for testing and case management, including between employees wearing face coverings and employees who did not during a potential exposure event, and for COVID-19 cases contracted at the workplace and those contracted elsewhere. And then very finally, regarding documentation and enforcement and testing requirements. Now, under the requirements of the ETS, transit agencies would be required to provide the same level of testing to employees who are wearing face coverings and employees who are not during a potential exposure, even though the risk of transmission for employees who are wearing face coverings is considered fairly low. Additionally, transit agencies would be fully responsible for providing tests at no cost to the employees, even if it can be proven that COVID-19 cases did not originate in the course of their employment. These requirements must be rethought and permit differentiation in treatment. Now, on the matter of documentation and enforcement of testing requirements, the ETS is generally silent. And here we request clarification on, from OSHA on expectations of an employer if employees refuse testing, and require guidance on whether agencies must maintain documentation that indicates the employees did indeed get tested. Finally, the ETS requires employers to provide testing to an employee at a frequency determined by the employee's presence at an exposed workplace. And as you heard other speakers speak to, there is, of course, a wide variety of interpretations of exposed workplace that are established in California state law that differ from those established here in the ETS. And again, these definitions that are used in the ETS can create confusion and ultimately compliance issues for transit agencies. Now, very finally, the ETS must clearly articulate what levels of exposure to a COVID-19 positive employee beyond simply their shared presence in an exposed workplace would trigger the testing requirements, and we ask for clarification in this regard. This concludes my comments. Thank you.
Thanks very much.
Okay, thank you. The next 5 people in the queue include Tricia at Ag Council, Daniel Nagel, Vince Hundley, and Basil Falcone, as well as Aaron Guerrero. I was counting. That was number 4, now number 5. So Tricia, please go ahead. Make sure to introduce yourself with your full name and company name.
Erica, let me just mention one other thing before we proceed.
Yes.
You know, if folks, you know, we've heard a lot about testing. We've heard a lot about exposure and exposed workplace and exclusion pay. You know, I'd encourage speakers who just want to echo prior comments to just give us a me too on the issues that they have, that they want to articulate and focus on, if they would, on any new perspectives on those issues. I'm just encouraging. I'm not, you know, we're not requiring that, but in the interest of just time and getting as much perspective on different issues as we can, I think it would be helpful. Thank you.
Thank you. And Doug, so when you're saying me too, are you suggesting that that take place via chat rather than verbally?
That'd be just fine.
All right.
Good idea.
All right. Very good. Tricia, your full name, please, and your company name. Go right ahead.
Yes, absolutely. Good afternoon, Tricia Geringer with Agricultural Council of California. Our members are part of the essential workforce and have been producing and processing food all throughout this critical time for families throughout the state and throughout the world, all while protecting the health and wellness of employees. So I will work through our key issues and also reflect Doug's request as best I can as well, to keep it brief.
I didn't mean to surprise you. Sorry about that, but you're right. So do what you need to do. Thank you.
Beginning with the scale for large employers, and that trigger under the outbreak, that's 3 cases within 14 days. For the larger employers in our membership, speaking to those who are subject to this standard, we believe it's not scaled appropriately for their size, and others have spoken to this. So I think it's best to say for us to alleviate this issue, we believe a percentage-based standard should be considered for larger employers of possibly 100 or more, rather than those number of cases, to better reflect the realities of that larger workplace. That was done in SB 1159, where there was a percentage set at 4% of the workforce to trigger an outbreak standard for over 100 employees. And we would ask for consideration of that and possibly leaving in place what's there for the smaller and medium-sized employees if that works best for them. I will not be redundant on exposed workplace. A lot has been said there. Obviously, we have concerns, but that will be in our written comments. With respect to employer-provided transportation, for us, some of the comments we've received back from our members on the ground is that within that section, the 3 foot spacing rule for employer-provided transportation is very, very difficult, particularly with respect to smaller vehicles. Instead of that, we would propose requiring face coverings, temperature checks, symptom checks as protocols instead in order to ensure protection. On testing, our members have come back to us with some thoughts on being able to test out of the exclusion period, where a negative test would be allowed for them to be able to return to work. Since we are part of that essential workforce, excluding large segments of employees is a really big issue when you're harvesting, processing food. So workforce stoppages can be really problematic and can actually impact our food supply chain. So certainly a concern there. Doug has covered this earlier. I heard what you said with respect to wanting to hear more on the challenges we're having on the ground with testing. So we will put that on the written side, but definitely still a challenge on the ground with respect to access, costs, tests taking quite a bit of time to come back. So we're working, our members of course are working diligently through those hurdles, and we can provide more info. Just a couple of clarification items we wanted to raise. On training, we would like clarity on the frequency relating to training, or whether it's multiple times or just one time training, if that's sufficient. That's been a question from some of our members, and also a definition of that quote, able and available for work. I've received numerous questions on what that means exactly. So with that, I will go ahead and finish up and say thank you very much for the time, and we will put more in writing. Appreciate it. Thank you.
Thank you very much.
Thank you. Next in our queue is Daniel Nagel.
Good afternoon, everyone. My name is Dan Nagel. I'm in-house counsel at Joseph J. Albanese, which is a large subcontractor in the Bay Area, construction subcontractor. Many of our concerns have been addressed by others, so I'll leave those. Especially Mike Donlin, Nicole Rice, Robert Mutry, all of those comments were very important to us. Obviously, the exposed workplace is a big question mark for a lot of people. I would ask that OSHA provide clarification and guidance with regard especially to outdoor workplaces, especially construction sites. As Mike Donlin noted eloquently, there are a lot of unique considerations on a construction site where there are multiple subcontractors, a general contractor, different safety officers, different access to information among the different employers. So what constitutes an exposed workplace and a work site under the 1159 language? We would really appreciate some clarification on specific to the construction industry. Aside from that, or going hand in hand with that would be the potential exposure on a construction site or another outdoor workplace. Would this be everyone that was on the job site that day, or would this just be specific people that were within 6 feet of the path of travel of the employee, something like that, something more specific? And then lastly, that wasn't, I don't believe, addressed earlier, was the employer provided transportation. We would request clarification on basically what this applies to. If there are company vehicles, for instance, and the employees are transporting themselves to work in the company-owned vehicle, my interpretation would be that that would not be covered by 3205.4, but we would like some kind of exclusion or clarification for that, so that our entire fleet of vehicles, even though they're being driven by one person, don't fall within the ambit of 3205.4. That's it. Thank you.
Thank you. Just a clarifying question. Are there cases where there may be more than one person in the vehicle? Should we address that as well? Or is it really just limited to people driving the vehicle that they're assigned to and allowed to take home?
Okay, sorry, I had some trouble with unmuting. It would be case by case. The majority would be driving themselves. And then maybe some kind of clarification as to multiple riders.
Got it, thanks.
Thank you.
Next in the queue is Vince Hundley, and just as a notification, following Mr. Hundley, we have Basil Falcone, Aaron Guerrero, Rose Kwiatkowski, apologies if I mispronounced your name, and John Kay. Mr. Hundley, please proceed.
Thank you very much. Great job, Kathy. I'm Vince Hundley, and I'm with Smart Safety Group in San Diego. We represent about 100 employers, about 8,000 employees. I'm also the safety director for the San Diego AGC. And because of that, I was part of a coalition of COVID construction contractors and member associations and building trades unions. We have about 22 unions who've approved our plan and helped us write our plan, which we wrote really because there was a bit of an absence of a plan from San Diego County, where the Bay Area had a lot of guidance. We were working to develop something workable or understandable for our members and the tradesmen. So it was Tom Lemon, his 22 unions and the building trade unions, the IBEW, and Andy Berg, the Associated General Contractors, and about 8 other management associations. So it really was a consensus doc, because it was written by safety professionals. I am one, and members of my committee helped me develop this, as well as my staff. So over a period of months, we wrote our plan and executed this plan and provided updates as things were fluid, and up until about 11/2, and that's when we knew about the new standard that was coming out. So we followed, and I'd like to recommend maybe to Deputy Chief Berg, thank you very much for putting the standard together. I think it was much needed in many workplaces where they don't have resources, such as our coalition, our union members, and our management associations. But we provided a plan that really complied based on Governor Newsom's orders with the critical infrastructure or essential workforces. And I'd like the division to consider addressing critical or essential workforces in there, similar to what they have through the state, and then look to the Centers for Disease Control for their testing strategy. It's more unique, I think, to crews. It's more intimate and requires actual more frequency than once a week testing. It's every 3 days. And we're a big fan of that. I think it was more appropriate for the situation and the workforces that we were working with. And we've been using that critical infrastructure workforce testing strategy that came straight from the CDC. We didn't reinvent anything. And that's really helped us control the exposure And with our response, it gives us a very structured workflow. It's a great work chart. You've probably seen it. It has different tiers and different strategies, and it might help us define closer a workplace or an exposure versus, you know, a lot of unknowns by employers. So I think that was a very useful tool. I'd like to thank you, Chief Parker, for your comments regarding respiratory protection, eliminating the exposure. I think we're pushing a lot of our employers who are working in high reach equipment where it needs to be with 2 crew members at a time, or sometimes in proximity for 15 minutes or more, because we need more than just 2 hands on it. There may need to be 4 hands or more if they're utilizing respiratory protection. So that helps me with exposure, and it also helps with the narrative. So those folks, really to convince them to do the right thing, to wear the protection we provided them. I'd like you to consider expanding, or at least making some differentiation between someone who's exposed and if they've already had a vaccination and or if they've already recovered. So as this pandemic matures and hopefully we get a handle on it through vaccination and or as more folks are recovered, there's a question, well, I'm vaccinated or I had COVID last month. Now is it 3 months? Are we going with 6 months? What sort of period of time do we think is reasonable to say you're no longer exposed, but past a 6 month or 3 month window, coming up with some guidance? And I think it would be useful for us to know that. And I really think some similar to the EEOC, frequently asked questions. I'm going federally on that. I'm sure the EDD has something similar, but on HIPAA and privacy, I think it would be helpful if the division could address something either with its own FAQ, talking multi-employer work sites. A lot of my contractors I represent are artisans, specialty contractors, and our workforce, once they're cured and they're past their 10-day period, or if they've been released to work because of, they're asymptomatic and their fever's gone after they've had COVID, I can't always get them back to work with the 10-day strategy. A lot of folks are requiring medical release, and that medical release, of course, has got someone's private information on there. So I think the EEOC federally says that an employer can require that, but now I'm dealing with a situation between tiers of employment, and can an alternate employer require that, or just some guidance on that, because we're kind of thumb wrestling over that right now. So those are my questions. I appreciate you all for having this meeting, and good luck.
Great, thank you, Mr. Hunley. I appreciate your aggressive efforts in developing a plan. Appreciate it. Thank you. Erica, who's next?
Next in our queue is Basil Falcone, and we have approximately, looks like 15 people in the queue total. So just to let you all know, please do keep your comments as concise as possible. Go right ahead.
Hello, my name is Basil Falcone. I'm with Environova, and I do environmental health and safety consulting for commercial, industrial, and government clients. Mostly want to touch on the comments that Mike Dolan and Daniel Nagel had made in regards to the construction industry. I'm in the San Francisco Bay Area.
I'm sorry to interrupt you. Can you speak up just a tad? There's a little bit of background noise.
Sure. Is that a little better, I hope?
Yes, it is.
Okay, great. So we're in the San Francisco Bay Area, and the Bay Area construction orders have actually been very beneficial and very clear to implement for the construction industry and in preparing plans and policies. But as an example of what is taking place now and has been taking place for months now is what has happened this past week, and I'm just talking about a specific job, but it happens all the time. You have the electrician come on site. He was out partying with friends the weekend before, ended up getting exposed. His buddy told him on a Wednesday, oh, now I came up positive. He goes and takes a test, but instead, because of work pressures and financial pressures, decides to keep coming to the job site. He's asymptomatic and then ends up getting his results on Friday, and then now has exposed that work site. What has been done on the local level following the Bay Area construction orders is we've isolated, because he was an electrician, it's easier to define where he's worked. We're able to go in and do the disinfection, the verification, and so forth. And what we've implemented, which is I think the piece that's really missing in regards to talking about the amount of testing that wants to take place in the order, is that contact tracing aspect of it. Because if you follow epidemiological pathways and standards, the contact tracing is the most important piece. We were able to isolate the workers that were directly around him and remove those people from the site, do the disinfection, and then bring the other workers back onto the job site. And in talking with one of the local testing providers, they have indicated that Homeland Security actually controls the distribution of the amount of tests that are allocated for different testing facilities. And so the constraints on being able to bring companies out to do an entire construction workforce or another facility are incredible, because a lot of facilities, testing facilities, are only allotted 60 or 80 tests that they can perform a day that are on site. And then that's also the antigen test. And so if you're talking about a PCR test, which takes longer and sent to a full laboratory, you're running into very different types of tests and different efficacies of those tests. So it really seems, and kind of this goes back to my question, I'll end up here, but, and it's a specific question to you, Director Parker. Have epidemiologists been working with you to create this standard and follow more of the guidelines that are in place between CDC and CDPH when it comes to the testing, and then adding in the contact tracing piece? Because that would solve many problems, because you're able to focus on the people that have the direct exposure, since this is mostly an aerosol transmittable disease. So I do applaud CalOSHA for doing what they have done and taking the lead on this, but I think this one aspect really needs to be focused on in order to solve many of these other problems that so many of the other industries have talked about. Thank you.
Thank you, Mr. Falcone. Just to quickly answer your question, we did work with CDPH, and they reviewed the language, and we made an effort to make it as consistent as possible with some of their guidance. So, but we will continue to consider that in the advisory committee process. Thank you.
Okay, thank you. Next in the queue, we have Aaron Guerrero. And just as an advisory, the next 4 people after that include Rose Kwiatkowski, John Kendrick, Rob Gruel, and Eric Kahn. Mr. Guerrero, please, or Ms. Guerrero, please go ahead. Sorry about that.
No worries. You've got a lot of names in front of you. So thank you for all you're doing. And thank you to CalOSHA staff and to you, Doug, for hosting this. We really appreciate the opportunity. This is Aaron Guerrero with the California Attractions and Parks Association, representing small and large amusement theme and water parks throughout the state. I will be extremely brief, but I did want to align our comments with those provided by primarily Helen Clary with PRR, Rob Moutry with the Chamber, Andrew Summer with Con Maciel, Steve McCarthy with the retailers, and Katie Hansen with the restaurants. I just wanted to kind of put it into a bigger context from our perspective. And it seems that the regulations approach is a blanket application to businesses of all shapes, sizes, and dispositions. And it seems to lack consideration for how this would be implemented by some large businesses, and businesses especially that involve guests, which, as you can see, is a lot of our business. And it's not just one piece of it, so I'm just going to try to bring them all together. It's when you take different pieces of the regulation and how it comes together that it's really problematic. We've got this very broad definition of a workplace that's coupled with a trigger of 3 cases for an outbreak. And that trigger, those cases are not limited to employees. So parks are going to have a very difficult time getting out of a never-ending loop of testing, and this testing is extremely costly. And it will be extremely costly, especially during a time when the parks are among the hardest hit by the pandemic. Most of them still aren't even open. So, you know, we're looking for additional consideration on how to make this more feasible for employers such as the parks. And then I wanted just to put a little bit of a personal comment. Doug, you mentioned the testing availability. It is a huge concern. I'll just say that we wanted to get my family tested before Thanksgiving. And I was on the COVID-19.ca.gov website for several days in a row, and I couldn't find a single testing site that was taking reservations for over a week in advance. So, you know, I'm really concerned that employers will have the ability to provide the tests as required by the regulations. And then to echo many others, we're also concerned with the consistency of this regulation with the different statutes that have been passed by the legislature, AB 685 and SB 1159 primarily. So again, thank you for the opportunity, and we look forward to continue to work with you on these regulations in the future. Thanks.
Thank you, Erin. That just reminds me of another bit of information that would be helpful if stakeholders can provide it. How often retailers or other people who have customers or guests, patrons, frequently in their place of business, the frequency with which you do learn of cases, whether that's from public health or however it may happen, just getting a better understanding of when you learn of cases in the general public, about people who were passing through your premises. That would be really helpful for us to have a better understanding of that. Thank you.
Thank you. Next in our queue, we have Rose Kwiatkowski, County of Alameda. Please go ahead.
Good afternoon. Thank you for giving us an opportunity to speak. I am a deputy county counsel in the County of Alameda in the San Francisco Bay Area, and we're really looking for clarification. Many of our questions have been already asked, so I'll get to the specifics. Under Section 3205C2H, it says the employer shall conduct periodic inspections as needed to identify unhealthy conditions, work practices, and work procedures related to COVID-19. We have many different work sites, and so from office buildings to firehouses to jails. So we're wondering there, maybe a little more definition as to periodic inspections as needed. Also, in particular to the model COVID-19 prevention program in Appendix C, there is an indication in the form. This is for information received regarding COVID-19 test results and onset of symptoms. There is a parenthesis that says attached documentation. We have not been requesting medical documentation of positive COVID tests, and so we wanted clarity as to whether Cal OSHA is asking for same, or if it's merely information documentation that an employee has provided, such as an email stating I've tested positive. I know you've heard a lot about I know you've heard a lot about others on the potential exposure, so I won't repeat, but we did have a question concerning giving notice of the potential COVID exposure, and it says in 3205C3B3 that it should be to all employees who may have had COVID-19 exposure and their authorized representatives. So we're looking for some clarity regarding whether the notice needs to be any employee who worked in the exposed workplace during the COVID-19 case infection period, or just those employees who've determined to be close contacts. And my final question for clarification is under Section 3205C3B4. Does the free testing during regular work hours apply to all employees in the exposed workplace, or just to those who have determined to be within the 6 feet, such as the close contacts? And that really goes to, again, the difference between the may have had and the potential. Finally, any other additional clarification you could give to the exceptions, employees who are accepted from the requirements in terms of the first responders and who are already covered by the ATD. You know, I understand what Eric said earlier in his PowerPoint, but if we could, you know, if there could be any more clarification, that would really help us out. We're trying to make sure we have our first responders, you know, out there, but we want to have the safe workplace. So that's all I have. And thank you again for having us.
Thank you for those comments, and we'll try to address all of those in our next round of FAQs.
All right, next in our queue, we have John Kendrick. Please go ahead.
Hi, good afternoon. Thank you to everybody. The comments here, I think, you know, a lot of what I was hoping to talk about today has already been covered. My name is John Kendrick. I'm an attorney. I have a fair number of clients who are obviously very concerned about how to effectively implement these regulations. Doug, earlier today, you wanted specific examples of problems with testing. 20 minutes ago, I got an email from one of my clients letting me know that they hit their 3rd positive test in the 14-day period. They're panicking. They're trying to figure out how to deal with testing right now. They contacted CVS. CVS said it would take 3 weeks to be ready. They're not quite sure what to do. They're reaching out to somebody who, and they don't have anything to do with the movie industry, but they're reaching out to somebody in the movie industry who's doing on-site testing. I can't imagine what the cost of that's going to be for them. So this is something, especially in Southern California, that's going to be a big issue of access to testing when you hit your outbreak status. Another issue that I don't think we've really talked about today is, you know, these regulations are from a pre-vaccine world, and now we're in a vaccine world. And so I'm trying to get a sense of how, for example, an employee who has been in close contact with a positive COVID case, but is fully vaccinated, would they still be required to be excluded from the workplace? It doesn't make much sense to me if we believe in the efficacy of a vaccine. And I don't really see any wiggle room on that, the way that the rules are currently structured. Another issue that keeps popping up, I've got clients who don't have engineering control over their HVAC. They might be in a multi-tenant building. If they can't control what the landlord's doing with the HVAC, is it just enough for them to ask the landlord, hey, can you do something to the HVAC to maximize filtration? And then, let's see. Sorry, I have a lot of notes. I'm trying to skip over stuff that's been hit over and over and over again. I would like to reiterate, when it comes to the FAQ, kind of changing how we should interpret the regulations, for example, clarifications on the exposed workplace. I worry what happens down the road if OSHA changes its position. You know, if your definition of exposed workplace when it comes to the testing requirements today is different than what you're saying a month from now, is there going to be an issue of somebody who's relied on your FAQ getting themselves in trouble? And the last point, you know, Mr. Motri covered pretty much everything I was hoping to talk about. The one thing I am wondering is if there will be any sort of stand enforcement, especially when you've got a lawsuit that was recently filed to nullify some of the impact of these regulations when it touches on the authority of OSHA to regulate pay and things of that nature. So those are my comments, but you know, I think everybody's done a really good job here today, and I appreciate the people who've been running the meeting. Thank you.
Thanks very much.
Sorry, I was on mute. Thank you, Mr. Kendrick. I appreciate it. Go ahead, Erica.
Next in queue, we have Rob Gruel. And just to give a heads up, after Rob, we have Eric Kahn, William Ken, Kenny Sambor, Toli McKell, Cassie Holoski, Megan Neal, and Gail Blanchard Sager rounds out our speakers so far. Rob, please go ahead.
Thank you. So John basically took all my comments that I kind of had planned, but just to very briefly echo them, we are seeing a lot of trouble with testing in California. They're refusing to test our employees unless they have symptoms. And on top of that, the tired paying people while they're out on quarantine, there's a lot of room for abuse where individuals who are essentially not sick might want to take free unlimited
Rob,
Yes.
Rob, this is Erica Monterosa. I just want to let you know you're cutting in and out a bit. Is
Okay.
there a way that you can maybe move so you have a better signal?
Can you hear me better now?
Yes.
Okay.
Please go ahead.
So what I was saying was I wanted to mimic John's comments regarding testing and the troubles that we're seeing in Southern California. They're refusing to test people that don't have symptoms. So those that have close contact won't be allowed to get tested. And then that leads into the secondary problem of the unlimited paid leave while on quarantine, and maybe a little bit more guidance around that, because there is a lot of room for abuse by employees who want to stay out for 4 to 6 weeks and get paid during that entire time. And I had one quick clarifying question. It was my understanding that these guidelines went into effect November 30th. However, while I was on this call, I believe somebody might have inadvertently referred to these guidelines going into effect on January 1st. I want to clarify that it is in fact November 30th, correct?
Yes.
Awesome. And that concludes my comments. Appreciate it.
Okay, thanks very much.
Okay, thank you. Next, we have Eric Kahn. Please go ahead.
Thank you. Good afternoon. My name is Eric Kahn. I'm the chair of the National Workplace Safety Practice Group at the law firm Kahn Maciel Carey. I'm speaking to you today on behalf of the Employers COVID-19 Prevention Coalition, which is comprised of a broad array of California and national employers. I have one process observation and 3 brief substantive comments to share, some of which have been touched on, but I have slightly nuanced recommendations about those subjects. As for the process issue, while we appreciate the division's willingness and the assurances throughout the day today that you will be issuing informal guidance, cleaning up some of the practical issues with the rule, we're a little disappointed to hear that the division apparently will not soon be honoring its commitment to move immediately to begin the advisory committee process and proposing actual changes to regulatory text, and may not even do so until next fall. When, in instances where guidance conflicts with regulatory texts, employers are put in an untenable situation of determining whether they comply with the rule and hope for the best that a district office or a compliance officer doesn't reject that guidance. And certainly in an enforcement action, an administrative law judge is, very likely, if not obligated, to follow the regulatory text. So it's a tough position that employers are put in. But more importantly, waiting until October to propose actual regulatory text amendments is not what I understood that the division assured the Standards Board would happen when the Standards Board was weighing whether it would vote to approve the ETS. Standards Board acknowledged that there were serious issues with the rule as drafted, but was comfortable voting to approve it that night only after the division assured that it would not wait months to engage in the advisory committee process and update the regulatory text.
Mr. Kahn,
yes, sir.
I think that was a participant who made that reference. We've said nothing of the sort about waiting till the fall to conduct an advisory committee meeting. We intend to do it expeditiously.
Yeah, I appreciate that, and I hope that does happen, and I hope not just initiating the advisory committee process, but also moving to promulgate regulatory text amendments. I understand that you've had some concerns about how you have limited bites at the apple, and I understand that in the context of an emergency rule, but that's not a good reason to, leave impractical and imperfect regulatory text out there and rely only on guidance. So we do hope that it's not just initiating the committee process, but also proposing a amended regulation. I hope that does happen promptly, as it seemed the standards board understood was going to happen when it cast its vote that night.
Yeah, my understanding is that under the current emergency, those normally abbreviated time periods may be extended or longer than, currently longer than they are on the books, which is 90 days. And I believe we've confirmed that, but that would certainly alleviate some of the pressure.
Yeah, that would be great. I think, regardless of the number of bites at the apple, I think if you have recognized issues with the rule, we think it's important to fix the rule. And we do appreciate, I want to be very clear, the guidance that you've already offered, the guidance that you've promised would be coming is extremely helpful, and we appreciate it. It's just that, as a regulatory attorney, I advise my clients, you follow the rule, and the guidance is helpful where it interprets, but where it seems to conflict, where some of this does, and we understand why, it's a way of trying to fix a rule that was done in an emergency context, and we appreciate that. We just think it's important to move quickly to actually amending the text, and I appreciate that you're looking into ways to do that without limiting your flexibility. That's great. The three substantive points, I'll try and go through them quickly because they've been raised in general, but there's some nuance in recommendations that we have. The first is how to address employees who refuse testing. And I'm speaking specifically in the context of those who refuse testing in an outbreak context, not somebody who's offered testing because they've been identified as a close contact. In that instance, we have some recommendations for how the rule could be clarified to address that. Basically the recommendation is that you present employers with two options for what to do in that circumstance. And one option would be to exclude the employee who's declining the testing. And if they're declining the testing just out of choice, perhaps not because of a religious or disability exemption, that the employer be permitted to exclude the employee without triggering the continued pay and benefits elements of the rule, because that is a choice of the employee to have that uncertainty around their status by declining the testing. But the second option, which I think is an important option, is that the employer, and I assume this is the case actually, this is how I've advised my clients, so I'd love clarity around that, is that you're permitted to allow that employee to continue working as usual as long as they've not been identified as a close contact by contact tracing. So if they're in the outbreak context, you offer testing to that entire unit, even if there's not necessarily a close contact, and an employee refuses, we would like to make sure we do have the option of allowing that employee to continue working as we would for any employee who's not been identified as a close contact. The second issue that I'd like to talk about is tying outbreaks more to a work-relatedness concept. And I understand, Mr. Parker, during the standards board meeting, you raised the point, and I agree with you completely. You're never going to have an outbreak that begins at the workplace. It always has to come from outside first, a non-work related case entering the workplace. And so I agree that it's reasonable not to limit outbreak status exclusively to work-related cases, but an idea that we think makes a lot of sense is that if we recognize that it's not going to start inside, it starts from outside, it still contemplates that it continues and grows as a result of and because of the workplace to really be considered an outbreak. So we think it would be reasonable to consider work-relatedness as to subsequent cases when you're calculating whether you've had three. So we've got two specific proposals that we think could address that. First, to say at least one of the three or two of the three cases that trigger a determination of an outbreak should be found to be work-related. Even using Cal OSHA's expanded definition of work-relatedness, I think would be acceptable. There's a presumption that if there's a recognized exposure between two individuals, but without that, just because they happen to be in the same general work area around the same time, we do think there ought to be some work relatedness to declare something an outbreak. If you have individuals, especially now over the holidays, where there is clear recognition and understanding where the cases came from, a sick spouse, we went to the Christmas dinner and it turned out that somebody there was infected. We know that it's not work related, but it's just 3 coincidental. That shouldn't trigger the onerous testing requirements there from our perspective. And then likewise, and maybe even more importantly, is that the outbreak status can continue indefinitely based on a single positive test of an employee who happens to work in that same exposed work area. We think that's especially unreasonable, and we think for those that would continue the duration of an outbreak, new cases, a single new case, we think that clearly ought to be connected to work relatedness, and would recommend it's just a couple of minor changes in the at 3205.1 A1 and A2. For A1, where it says when there are 3 or more COVID cases in an exposed workplace within a 14-day period, we would add at least one of which is determined by the employer to be work-related. And for A2, we would say the section shall apply until there are no new work-related COVID-19 cases detected in a covered exposed workplace. So an idea that we had there to manage and really focus on situations where there really is spread within the workplace. And if you've done a great job of knocking that out, that should be treated as appropriately ending an outbreak. The last point we want.
Oh, go ahead.
Go ahead.
My last point is about recognizing the special status of critical infrastructure workplaces. There's been a lot of comment today focusing on the CDC's updated guidance and Governor Newsom's basically amending this rule by executive order to recognize the 10-minute quarantine issue. And folks have asked that we expand that for critical workplaces to include the 7-day with testing after 5 days beyond just healthcare. I'd go a step further than that and say that the rule ought to just adopt CDC's existing guidance, this is what it's called, the COVID-19 Critical Infrastructure Sector Response Planning, which allows in critical infrastructure in dire need for staffing purposes to allow asymptomatic close contacts to continue working even short of 7 days if there's universal masking, screening, they're asymptomatic, and it's real dire need of staffing. So just expand the way you are allowing critical infrastructure to deliver the critical services that are needed for Californians. I appreciate the opportunity to visit with you today. Thank you.
Thank you, Mr. Khan.
Next in the queue, we have William Ken. Please go ahead.
Good afternoon. My name is William Kim. I'm with the law firm Littler Mendelson. Along with me today are 3 of my colleagues, Kenal Sambor, who will be speaking next, and Alka Ramchandani, Raj, and Melissa Peters. All of us represent employers who are in process of complying with the regulation and wrapping their heads around some of the difficulties in compliance. We understand several issues have already come up, many of which have already been covered by other stakeholders today. So we won't reiterate those same concerns, but echo those same concerns as well. We do want to present some additional information, however, based on our clients' concerns. Many of them do not wish to speak up for business and proprietary reasons, but they have provided us with information, and we can confidentially submit it if it interests the board. And we will also likely submit written comments. But we have 3 areas of particular concern that we would like to raise today. First is related to Chief Parker's request to talk about some of the issues people have had with testing. And because they are required to have testing, but they, not every county has sufficient sites to provide them. And so in a few instances, our clients have been sending employees to the sites and have paid them for those 4 to 5 hours to get tested, but because of testing capacity, those sites ran out of those tests and they had to send the employees out again to get tested. So, keep in mind, this amount has, includes not just the 4 to 5 hours, but the time spent on mileage and the loss of production costs associated with an employee's absence. The second area of concern is regarding how much these tests cost, and they range anywhere from about $120 to $180 per test. And we have one of our clients who informed us that they've been paying about $160 per employee. But under the regulations during an outbreak, they would have to test approximately 5,000 employees based on the definitions as it sits today. And so in total, that could cost them almost around $800,000 just based on this testing requirement in an outbreak situation. And 2 weeks of testing will cost double that, obviously, at 1.6 million. And I want to just share that this particular client is designated as a critical infrastructure client under the local rules. And they are, in fact, assisting with distributing the vaccine. And so with such a high cost of testing, you know, they're at a point where they're finding it unsustainable to stay in the business.
Kim, if I could ask a clarifying question, is that, would that be in an outbreak or a major outbreak? And do they consider all 5,000 of their employees to be in the same exposed workplace, or is that just a worst case scenario?
It's the worst case scenario that I'm talking about, and it could potentially be considered in just a minor or a regular 3-person outbreak, just because and this particular client is who I'm referring to is in sort of the logistics space, and so the exposed workplace could be, you know, a couple thousand feet within that 14-day infectious period, and thus could potentially trigger that obligation to test all 5,000 of those employees.
Thank you.
You're welcome. And lastly, we just want to share some concerns with our hospitality employer clients. You know, as many of us on this call have seen and heard, you know, there's been 30 to, you know, these clients have suffered a revenue drop of 30 to 50%. You know, they have spent, just based on OSHA's guidance and Cal OSHA's guidance, you know, $5,000 to $10,000 per employee on just extra PPE, cleaning, and other requirements. And many of these employers are just working with a bare minimum staff, don't have adequate coverage to send employees off-site for testing. And so, you know, and for safety and other critical infrastructure concerns, you know, they can't shut down their operations to allow for testing. And many of these, you know, back in March, they've had less than 1% of positive cases. But since the holidays and the current status here in California, now they're seeing, you know, 3+ COVID non-work related positive cases in an outbreak. So I only say that because some of these employers have already paid in excess just from past situations, you know, of 7 figures for the supplemental paid leave because they enacted and abided by conservative contact tracing procedures throughout the year. And so if we take all of these factors into consideration, many of these employers are facing issues with sustainability and whether they are able to be viable in the near future based on these requirements and these and the compliance issues with it. We all understand that there needs to be an improvement with regards to protection. However, you know, what we want to see is some striking of balance, especially in the critical infrastructures sector, you know, providing aid to fight the virus and also maintaining and making sure our clients are viable and able to get through this unfortunate public health crisis. So in sum, I urge the board to think about these factors and to take into consideration how we should change the regulation and make it feasible for these critical companies to avoid such drastic measures. Thank you, Chief Parker, and thank you for your time.
Thank you, Mr. Kim.
Thank you. Next in our queue, we have Kenny Sampwer. Please go ahead.
Hi, good afternoon, everyone, and good afternoon, Chief Parker. My name is Kenny Sambor. I'm with the law firm of Littler Mendelson PC, a colleague to the previous speaker, William Kim. My office and my firm represents a wide range of employers, those who are very small and those who are also global companies with various locations around the world, and of course, certainly in California. Again, without being too repetitive of what other speakers have, of course, more artfully said than I will be able to say today, we and our clients share in their concerns. As many of the comments today have highlighted, the concerns that my colleagues and I share are focused primarily on the feasibility and the implementation of several of the requirements under the ETS as it's currently drafted. I do know that during the November 18th Standards Board meeting, one of my colleagues had emphasized the importance of the feasibility concern, the concern that our clients and employers are not going to be able to comply with a standard that's could ultimately be ineffective, infeasible for our clients, and also will not ultimately protect workers. We have multiple clients with large worker populations across the state, and as we've learned to date, some of them have been unsuccessful in retaining a single testing vendor capable of handling their demands. And again, depending on where the employer can be located in California, the cost of testing itself can range from a single employer from $120 to $180. Just doing the rough math, an employer that's got to test 100 employees in a shift is going to be spending anywhere from $12,000 to $18,000 each time they must test. And of course, continuing further, one with 400 employees in a shift will be spending anywhere from $48,000 to $72,000 each time they're required to test. Relatedly, an employer with 400 employees on a single shift will certainly almost trigger the outbreak status by sheer numbers alone. And for this reason, we'd ask respectfully that the division consider the number of positives to trigger an outbreak in an exposed workplace to more proportionately account for the number of employees in that setting, rather than having a one-size-fits-all number applicable to all workplaces, regardless of workplace population. Lastly, would appreciate more guidance from the division on the specific return to work exemption for critical infrastructure workers, whose exclusion would create an undue risk to a community's health and safety as set forth in Section 3205 C11E. First, as to substance, we'd appreciate more clarity on the criteria by which Cal OSHA will evaluate and grant these requests, but also more clarification on the duration of the exemption, for example, and whether the employer will be required to submit these requests, for instance, on a facility by facility basis, if that's necessary. And finally, as just to procedure, we would very much appreciate any guidance as to timing, and specifically whether the division has devised a mechanism to fill these requests and the means by which it will evaluate and process them in an expeditious manner, just given the urgency by which our clients, particularly in these critical infrastructure industries, would need that issue and request to be resolved. Thank you again, everyone, and thank you again, Chief Parker.
Thank you. On that last point, we intend to have something out again next week that gives some more guidance. We're ultimately going to require, a brief written request, but we'll also have mechanism for people to, obtain provisional approval while, in an emergency where they need to develop a written justification. So we'll have more out on that soon.
Thank you.
Thank you. Next in our queue, we have Toli Mikkel. Apologies if I mispronounce your name. Please go ahead.
My name is Toli Michael with Park Environmental. Basically, my question or my request would be that the division clarify the term fixed workplace in its regulation. I believe it's C8A, where it says at fixed work locations. I know other commenters have already made mention regarding the requirement for partitions. My request for clarification on the word fixed work locations is that, does a fixed work location mean a temporary work location? Does it mean a mobile or stationary work location? The nature of my particular employer, we do a lot of, we're related to construction. So for us, for example, does a trench count as a fixed work location? Or does a scaffold count as a fixed work location if we have two employees with it less than 6 feet apart erecting a scaffolding? Or for example, we'd also do a lot of confined space work. So does that confined space, especially a permit required confined space where you may have employees in close proximity to one another just based on the physical configuration of the space, does that confined space, for example, count as a fixed work location? We would like to see, I would like to see some clarification on that. And then echoing other commenters with respect to, it's very rigid in terms of requiring physical partitions, some sort of language modifying that requirement if the employer can demonstrate there are other mitigating measures. For example, if a fixed work location is outdoors, if employees are utilizing other means of protection such as respiratory protection, ventilation, et cetera, just to allow a greater flexibility and feasibility with respect to this requirement. And that's all I have for my comments. Thank you.
Thank you. We'll attempt to clarify that. I will say I don't think that there are going to be a lot of situations in construction where you have fixed work locations, but we'll provide some clarity on that question. Thank you.
Okay, just to let everyone know, we still have about 10 people in queue to speak. And we've got the next 5 people in queue include Cassie Holaski, Megan Neal, Gail Blanchard-Sager, Jasenia, Ann Catton, and Cheryl Edmondson. And with that, Cassie Holaski, please go ahead.
All right, thank you. So in addition, Cassie Holaski with Nibby Brothers, a large general contractor in the San Francisco Bay Area. So in addition to the many, many, many really good requests for clarification, I have just 2 simple ones to add. One, in the FAQs, it made it clear that the intention of Cal OSHA is not to include areas where people don't congregate or interact, such as corridors, etc., in defining the exposed workplace. But it's occurred to me and some of my colleagues, what about elevators and man hoists? So very temporary in nature in terms of people going up and down to access the building. Just wondering if, because a worker, in the outbreak scenario, if 3 workers happen to have used the man hoist to get to where they need to go, am I now opening up my entire job site to the exposed workplace definition? So a clarification on elevators and man hoists would be appreciated. The second one would be about notifications. On page 5, 3B of the regulations, it talks about notifications, and it says independent contractors and other employers present at the workplace during the high-risk exposure period. So just a clarification, are we talking about the exposed workplace, or are we talking about the entire project? So if I have 3 cases, for example, on the 4th floor, and I've narrowed it down to really that's where all my exposure has been, do I have to notify the employers and the entire building, or just the employers related to being on the 4th floor? So those 2 clarifications would be much appreciated. And that is it for me. Thank you.
Okay, we'll clarify that latter one and also try to put it in the context of 685 and what if any additional requirements apply there. And I believe our FAQs on exposed workplace are going to resolve your question about the hoist or the elevator.
Thank you. Next in queue, we have Megan Neal. Please go ahead.
Hello, Chief Parker and advisory committee staff. Thanks for allowing me to speak today. My name is Megan Neal. I'm the director of EHS for PW Gillibrand, and I'm speaking with you as a critical infrastructure employee and a safety professional. I guess I would like to ask a clarifying question that I might not have heard previously. Caught it in the chat regarding employees who are wearing respiratory protection that have a protection factor of at least 10 times, so either an N95 or a half face with P100 cartridges, would, even though they have exhalation valves, would not be considered close contact or exposed if one of those individuals working within 6 feet for more than 15 minutes tested positive?
It wouldn't be a close contact for the person wearing the respirator.
So if both employees were wearing respirators, then that would not exclude them from the workplace.
Correct.
Thank you very much. I appreciate your dedication to this matter, and I think most employers are really trying to do the right thing, and we look forward to getting additional guidance from the district. Thank you.
Thank you. Appreciate it, Ms. Neal.
Thank you. Next in queue is Gail Blanchard-Sager. Go ahead, Gail.
Good afternoon. Thank you for the opportunity to speak on behalf of California's hospitals. This is Gail Blanchard-Sager with the California Hospital Association. And I want to start out, just in recognition of all the work our frontline healthcare workers, everybody in the hospital, really, from nurses, physician, employee safety, environmental services, the work that they're doing right now. So this is obviously incredibly important. We want everybody to stay safe and not get infected, because we really want you to stay healthy and out of the hospital, because obviously there's a real surge happening now. So I will focus my comments on the hospital perspective. As you know, the hospitals are covered by the aerosol transmissible disease standard, and as I had indicated during previous conversations, as well as the standard board meeting, there appears to be some confusion and lack of clarity around the application of this emergency standard to hospitals. And so I'm kind of comparing the actual language of the standard with the FAQs, and then I want to kind of talk about the reality of what I understand is happening on the ground. So the standard says that it does not apply when employees are covered to employees when covered by Section 5199. Now, our perspective is that hospitals and all of their employees in the hospital are covered by 5199 because the ATD standard covers a facility. And as I described last time and in my written comments previously submitted, while it might apply differently to payroll departments or administrative departments, it applies broadly. We're using the same infection prevention experts, the same employee health, all of the same policies and procedures that are applied throughout the hospital wall to wall. So I believe that the way the standard is written can and should be read that way. So when I go over to the FAQs, it's written a little bit differently, and I think it's creating a lot of confusion. It says that the third question, that does the regulation apply to any facility that's covered by the aerosol transmissible disease standard? And it says that, well, the emergency standard would apply to administrative employees who work only in an office environment separated from patient care facilities. I'm not sure what that means. And again, because the workforce is so integrated, human resources might be in a building across the street. I know there's a large hospital in downtown LA. Their security offices and their HR offices are across the street. But there's constant going back and forth. Folks from HR are going over to the hospital. People from the hospital are coming over to HR. Obviously, everybody's using the cafeteria. So there's a lot of integration. So I guess what I'm hoping is to get clarification, either that yes, the aerosol transmissible disease standard does apply to the hospital, to every employee in the hospital. And if you're not willing to go that far, I'm really following up on a suggestion that Michael Miller had to recognize that if you've got a process in place that is basically providing even more protection than the emergency standard, that there would be a recognition of that, because it really does not make any sense. And frankly, I think it's kind of not in the best interest of employee safety to have our very strained and stressed employee health, infection prevention, and all of those folks who are applying all of the policies across the hospital, to then now have to create a whole nother plan for a small subset of folks who are really already covered, whether expressly or implicitly, by the hospital's aerosol transmissible disease standard. So I know, Doug, I've mentioned this several times, both previous to the standards board meeting as well as during the standards board meeting, and would really appreciate the opportunity to further discuss that. The second point is on testing, and I second and third everything everybody said on testing, and really adopt the presentation by Helen Clearly from the Fillmore Regulatory Roundtable. But again, my perspective on testing is also a public health perspective. We are extremely concerned about the strain on the testing capacity of this state. And what that means, the more employees who get tested, means that there are less tests available for patients and for healthcare workers and other essential workers. And so we are incredibly concerned about this. And I really, I know you indicated that you had worked with CDPH on this, but really communicating with the testing task force, and I'm happy to provide additional information. I know the regulation refers to a viral test. I don't know, I don't know that that's at enough level of specificity. So if we're talking about the PCR test, well, that's what's really in short supply, frankly. Some of our hospitals, and I can get you this data, for their own patients, they're now having to wait, 2 days to get the information back on patient testing. So definitely from a public health perspective, incredibly concerned, and really strongly recommend that the testing requirements be really, kind of hone in on the issue. And then the third piece, just want to highlight, this really is kind of the essential workforce. There are some aspects of our health systems that are not covered by the aerosol transmissible disease standards. So for example, some health systems have call centers where calls can come in to schedule appointments or do kind of that nurse triage kind of thing, but it's really not part of the hospital. It's really its own separate entity. So it would be covered by this standard. And with the outbreak section, again, as other folks had said, but I really want to put it in the context of healthcare, these folks who are answering these calls, if they had to be quarantined and off of work, would shut down patient care for, that, whoever they're serving. So we really do need some recognition around critical infrastructure workforce. So with that, I will conclude because it is late, and really would like to continue to discuss all of these issues. Thank you.
Thank you, Gail. Yeah, if it would be helpful to get more information on how maybe employees who aren't providing patient care, for example, are receiving protection, or there's controls for their exposure in hospitals, exposure control plans. Just getting a better understanding of that would be helpful, in what sort of actual protections are in place for the kind of employees that you're speaking about. On the question of the viral test, it's not limited to PCR tests. It's any
well, and I think that's right. And so I think actually clarification on that, there might be confusion about that, because frankly, I think the other concern is if it's not the PCR test, there's reduced levels of accuracy when you start kind of going down the line. And so then it kind of begs the question, is it really worth it if a test is only 50% accurate? So I'm not a clinician, but I think that the whole testing discussion really needs to, need further in-depth discussion with the experts, frankly.
Any test approved by FDA is allowed, and the antigen test is allowed, and that's less accurate where the viral load is very low when the person is not infectious. But you're really worried about when the person is infectious. So the antigen test works fine for this usage.
Okay. And I did see, so clarifying that maybe in the FAQs.
It says right in the regulation, any test approved by FDA or that has an emergency use authorization from the FDA is acceptable. That's right in the regulation itself.
Thank you very much. Erica, who's next?
Yes, next in the queue, we have Jasenia. Jasenia, please introduce yourself with your full name and your company name. Go ahead.
Say allow. Okay, there we go. Okay, hello, my name is Yesenia Villasenor.
Yes, Jasenia, we can hear you. Please go ahead.
Okay. Can you introduce? Thank you.
Can you include your company name, please?
Sure. I'm sorry, I'm getting like a back feed. Okay, can you hear me okay?
There's a little bit of distortion.
Oh. Yes, my name is Yesenia. Okay, is better?
It's if you go ahead and speak, and if there's distortion, I'll let you know. So just forge ahead, please.
Okay, great, thank you. Okay. My name is Yesenia Villasenor. I work with Tesla's environmental health and safety lawyer. I echo many of the same comments that were previously shared, particularly as it indicates for large employers and having different considerations for them as it relates to appropriateness of some of the regulations and how they actually, the implications of those regulations for large employers, but specifically the new question or guidance I would like to request that Gallo to consider relates to 3205.
Yes, Yesenia, I'm sorry to interrupt you. I'm going to suggest you take your video off because it sounds like your internet connection is degrading a bit, and we'll see if your audio improves.
Okay, is that better?
It sounds like it, but until you begin speaking at length, I won't know. Go ahead.
Okay, great. Okay, so my comment relates to 3205.1 and 3205.2, and specifically as it relates to when an employer is the starting date for calculating an outbreak. There's various dates that can be utilized, and so, for example, is it the date that the employee notifies you of the positive test result, or is it the first date of symptoms, or is it 2 days before the start of symptoms? And so clarification on that would be very helpful because there are numerous requirements that are imposed on employers in terms of once you meet those triggers of an outbreak. And so having guidance on when to start the clock, if you will, would be helpful.
Doug, did you get that? There was a bit of distortion.
The start date of an outbreak. Clarification on that, right?
Yeah.
Okay, yeah, I got that.
Thank you very much. Next in queue.
That's correct, right?
Yep, thanks so much. Next in queue, we have Ann Catton. Please go ahead.
Is this better?
Ann, you're on mute. You have to unmute yourself, ma'am.
Okay.
There
hello?
you go.
Okay.
Yes, we hear you.
Places. All righty. I'm Ann Catton from California Legal Assistance Foundation. Good afternoon. I just wanted to start by saying that we think the regulation, for the most part, is well designed and fills a really urgent need. And we think it's critical to maintain the pay benefits for sick and quarantine workers, particularly critical for low income and seasonal workers. And that we think a low threshold for definition of outbreaks for large employers should be retained because for large employers, potential exposure of so many people is at stake. Then I mainly wanted to focus on the issue of employer provided housing. In housing provided by the employer, it's also crucial to maintain, and we think even strengthen, the 6-foot distancing rule for beds. As the division has pointed out, the 6-foot distance is based on average distance that the large respiratory droplets travel before settling out. And the smaller aerosol droplets can travel much further. 6 feet does not provide total protection, thus, from infection. an infection risk increases with amount of time exposed, such as if you're sleeping in an area, of course. We therefore urge a more protective requirement based on maximum occupancy of bedrooms of 2 people per bedroom and maintaining density, a minimum density of living space. We note that increasing square footage per occupant in dorm rooms to 100 square feet per person has been shown to reduce infection rates. And we'll provide some references and some additional written comment. Thank you.
Thank you very much, Anne.
Next in queue, oh, by the way, I'm going to give the last people we have in queue, as we have about 20 minutes left on the clock, include Cheryl Edmondson, Mitch Steiger, Eric Fruman, and Pamela Murcell. So Cheryl, please go ahead.
Hi, can you hear me?
Yes, I can.
Great. This is Cheryl Edmondson with Bank of America. So just want to start out by saying I really appreciate the forum here and all the questions from the stakeholders. Just a few sort of straightforward process questions. I understand you guys will be clarifying the terminology for exposure, exposed workplace. So in the interim, is it safe to say that we can continue to comply by using the 6-foot, 15-minute, 24-hour standard in terms of notification of close contacts? And then in terms of the training requirement, we continue to share a lot of resources on the enterprise level, just as part of our ongoing internal all-employee communications. Just want to make sure that meets the intent, or are you looking for something more formalized? Alongside the training aspect, we are a multi-employer work site, so how do we handle the responsibilities under the standard of vendors versus subcontractors in regards to their training? And then the last question I had was the language used to refer to proper use of face coverings and the fact that they are not respiratory protection. Is that just something that's more geared towards workplaces where it's required? You know, this language would not necessarily apply to us because we don't have job functions that require respiratory protection anyway. So I appreciate your time, and I look forward to seeing when you get the guidance out there on the website. And also, do you have an ETA on when that guidance might be updated? And are you going to include all of these questions and answers on that guidance as you compile it from today's meeting? Thanks so much.
Thank you. We'll answer some of the, put up some of the FAQs next week, and we'll you know, continue to update them. I think from what I've heard, I think we'll be addressing most of them. Some of the more specialized ones, we may reach out directly to the folks who've asked. But in general, we'll be addressing the you know, the same topics and most of the issues that have been raised in this forum, as well as others, some of the others that folks have submitted to us.
Next in queue, we have Mitch Steiger. Go ahead, please.
Thank you for the opportunity to speak today, and thank you for the forum, as was mentioned. Would largely echo the comments of CRLAF. All of those points were really important ones that we totally agree with. We would just add one and really focus on another. The one that we would add is that what we keep hearing about, the feedback that we keep getting both from affiliates and individual workers and even friends of mine, is that the real problem we need to address here as it relates to COVID-19 safety is retaliation. That workers see violations of this and of the guidances all the time, and they're too scared to do anything about it. Where they see examples of retaliation, they hear comments from their employers that one way or another threaten retaliation. And one way that we think the standard could be strengthened, and something that would really tie all of these together, is some more clear language protecting a worker's existing right to not be retaliated against for reporting violations of this, bringing up violations of it to their employer, or anything like that, that could really only benefit the whole system. That's something that we would really encourage. We'd also really focus on one point that CRLAF mentioned, where there's been a lot of talk today about the outbreak requirements and that larger employers should have some sort of more floating definition that just 3 cases is too low. And as was mentioned, with a bigger employer, the risk is more. That with a large employer, the opportunity for an outbreak can much more likely become a major outbreak. And something that gets out of control will get much worse than it will with a smaller employer. So it can just as easily be argued the other way, that we need stricter protections for larger employers who also have more resources to deal with some of the costs of this, and ways that we can help prevent these outbreaks, prevent individual tests from becoming outbreaks, and prevent the outbreaks from becoming major outbreaks. We think that's a really important consideration. And I just finally wanted to respond to a lot of the general comments that have been made today about the costs of this to employers, which are very real. And we certainly don't mean to diminish that this is not free. A lot of the measures outlined in this standard do cost money, especially testing is absolutely not cheap. But as we weigh possible ways to weaken the standard, adjust it, bring it down, make any changes to it, not only do we strongly recommend that we don't do that, but that whatever we do, whatever conversations we have, whatever ideas we come up with, these need to be weighed against the costs of workers getting this disease, both the financial costs and the human costs. They're both very real. And the financial costs are often not quite as quantifiable as they may seem at first. That the cost of a test is very simple, but the cost of one worker getting this, and then it spreading to 2 and 3 workers, and then them going and spreading it to other people, most of whom are also workers. It's hard to put a dollar figure on that, but it can become overwhelming very quickly. And then that says nothing to the human cost, the cost to families of losing people, of people suffering permanent illnesses as a result of this, cost to the healthcare system. That when we think about, okay, well, we can save this much money by testing if we make this change to it, we also need to keep in mind that there are going to be massive costs down the line for everything that we do that weakens this standard, that we think we should all be very proud of, that we think should be protected, that we think stands as a model for the rest of the country and what they should be doing to not just keep workers individually safe, but also really slow the spread of this whole thing. So we would just really urge everyone involved to keep that in mind as we discuss potential reforms to the standard. Thanks.
Thank you, Mitch. Yes, our intention in the way we crafted Exposed Workplace was to adjust the scope of testing in a large workplace rather than adjusting the number of people, because we thought that would be more preventive and address early detection, if you will. But we're certainly, listening to all sides on how we might address some of the concerns that were raised. But thank you for your comments. Appreciate it.
Doug, I want to do a time check with you. I understand that the intention was at 4:45 to do a recap. We currently have, we had 3 people in queue, and Cynthia Rice just jumped on the bandwagon. So I just want to touch, and Cynthia, I realized that you had raised your hand earlier and then decided to lower your hand. So I'm not in any way trying to diminish you joining the crew, but I just want to touch base with you, Doug. What would you like to do? Shall we go ahead and ask that these last 4 individuals give us their comments, and that might take us past 5 o'clock, and then do a recap? What would you prefer?
I would prefer to continue to hear what people have to say.
Very good. So having said that, in queue, we have Eric Fruman, Pamela Marcel, Maggie Robbins, and Cynthia Rice. And go right ahead, Eric Fruman.
Okay, can you hear me all right?
Loud and clear.
Okay. So my video, you have to allow my video to work, I think. So if you can get that working, fine. But in any case,
no,
I'll start talking.
I've not done that for anyone else. So I think that's
okay. No, now it comes up. There we go. Okay. Thank you. Chief Parker, and to the rest of Eric Berg and Erica Monterosa and the rest of the DOSH staff, thank you so much for the work that you've put into this. My name is Eric Fruman. I'm with the Labor Union Federation Change to Win. I'm the Health and Safety Director. I want to, first of all, echo the comments from Ann Catton and Mitch Steiger about some of the specific issues they addressed, and Mitch's comments overall. I have a couple of comments about some very narrow sections of the standard, particularly regarding how workers will receive information from their employers. But I want to first preface that by saying something about the context for it. When we were discussing this standard during advisory committees meetings over the summer, and in the proceedings before the Standards Board, we talked about the need for the board to proceed with this because of the next wave. Well, here we are. And the implications of this massive wave of cases for the state overall are still being tallied up in terms of the human costs, the social costs, the economic costs. But it's clear that this is an all hands on deck moment, and you've made a huge contribution towards the community effort to involve everyone, including in the workplace, to try to limit the spread of the disease. So in the nick of time, it would have been better if it had happened sooner, but it's thank you so much for moving it quickly into the Standards Board. On the question of the outbreak, which is of course outbreak definition, which of course is closely related to the overall efficacy of the standard. Yes, we strongly support the maintenance of low thresholds, because if you're dealing with a highly infectious agent like this, really not unparalleled in our medical history, but up there, the whole idea is to contain it as early as you possibly can. And where employers have actual knowledge that there are cases going on in their workplace, the standard is sensible in focusing their attention in a very aggressive way on limiting those exposures and bringing those exposures to the attention of the health department and to the division. So I just wanted to support maintenance of low thresholds, whether it's an Amazon warehouse in the IE of thousands and thousands of workers, or, you know, a large McDonald's restaurant in Oakland where we have, 25 cases out of 30 people, and the boss still isn't taking adequate measures. I would just want to respond to the restaurant industry's comment that they can't afford it. The restaurant industry continues to, some elements of the restaurant industry continue to be open and serving the public and making money, and it's essential that they operate safely if they're going to do that. I wanted to just narrowly address the provisions under C3 and C9 regarding notification to workers of critical information, as well as the requirements for the notification of the written COVID prevention plan. Under C9, you sensibly require employers to keep pretty detailed records of the COVID cases in order to do what so many people today have focused on, identification of close contacts. And I salute all the people on this call who've talked about the importance of this and the importance of accurately defining the exposure question. As you, Chief Parker, have said, and others have said, limiting our focus to the exposure question is so important. And the record-keeping requirements in C9 point to the location of the workplace where the worker was exposed. The details of that the employer must find out about, keep records of, are not spelled out in the notification requirement to workers. The boss is simply obligated to tell workers that there's been a case, but not to explain in no uncertain terms, as clearly as possible, exactly where that case was and where the exposure might have taken place. And that is critical. There's so much misinformation, so much cover-up going on still today. So many managers still today telling workers, there was a case, I can't tell you where, or yes, it was over there, but you must not talk about it. I mean, as incredible as that is, we hear this all the time. So I encourage you to be specific in your FAQs about the employer's obligation to report every single piece of information except for that which is medically confidential to all of the people involved in the workplace who have any possible need to know it, and to make that information also available on request as part of the COVID prevention plan, so that there's as free a flow of information whether managers want to or not, because we're still seeing too many managers who are reluctant or simply refusing to disclose this information to the people who need it the most, the people who were definitely exposed, the people who might have been exposed. So the information requirements are very important. Thank you so much for including them. The requirement on employers to provide information to workers are very important. Thank you so much for including them. And the more you can consolidate them in the FAQs in a way that is helpful to employers and workers to understand what that interaction is supposed to be like, so that it's all in one place in the FAQ, the more it will encourage good behavior. Thank you so much again for your work.
Thank you, Eric. Appreciate it.
Next in queue, we have Pamela Murcell. Please go ahead.
Hi, everybody. Getting late in the day, and thank you so much. This is Pamela Murcell. I'm representing the California Industrial Hygiene Council. And I'm not going to go through the litany of our comments. We did provide written letter with comments and questions and clarifications requested for the division to consider. So our written comments will speak for themselves. Suffice it to say that they do cover, for the most part, the issues that have already been raised with the speakers so far today. And one thing I would like to reiterate, I think is important to state at this point. We have many, many stakeholders. We have a lot of people who are interested and concerned that this emergency temporary standard be the best that it can be and really be in a position to benefit the workers in the state of California. And in that vein, I would just like to state the obvious, that it's extremely important that we need to work together to improve these regulations. And it is clear from today's comments and the number of folks who have commented that there are many clarifications that are needed. And before I close, I would like to actually ask a question. I don't know that I heard anyone ask this so far, but the question I have is this emergency temporary standard intended to be temporary, as the name implies? In other words, the regulations will be in existence only for the time that they are needed, and there is no intent to make them permanent. I don't expect an answer right now, but I would like to put that question on the table again for an answer and for clarification. And with that, I just want to thank the division. I know this has been an incredibly challenging effort. I know it's been incredibly challenging with the number of hours and work that's been put in, and everyone's time and consideration for us as stakeholders to hear what we've had to say. With that, thank you, and I'll cede my time.
Thank you, Pamela. Appreciate it. And we will get you an answer on that at some point.
Thank you. Appreciate it very much.
Next in queue, we have Maggie Robbins. Please go ahead.
Okay, hi. This is Maggie Robbins. I'm with WorkSafe, and I don't want to echo what other people have said. I just want to ask one question that was unclear to me in the standard as it sits. I also agree. I think it was a very well thought through standard, and I think there's been a number of questions that are going to point to areas to clarify it and hopefully not weaken it. My question relates to 3205 C10 and The question is, what happens if a person reports symptoms? So they're not exposed, they're not a case, but they've reported symptoms. Earlier in the standard, it also talks about asking workers, suggesting that employers might ask workers if they're having symptoms. But it's really silent as to what happens if a person says, yes, I'm having symptoms. I've read it through several different times, trying to figure out what direction it provides in terms of how a symptomatic person should they be given testing? Should they be excluded or not? Are they only excluded once they're a case? Anyway, so I think offering clarity as to what is supposed to happen when a worker reports symptoms would be helpful. And I look forward to your other clarifications as they come down the line. Thank you.
Thank you, Maggie. That's helpful, and we'll address that.
Thank you. And our last person in queue, last but certainly not least, Cynthia Rice. Please go ahead.
Hey, you're all going to be thrilled to hear, if you're at the standards board meeting, that I have just three short comments to make, really reflecting some of the testimony earlier, or the comments made earlier. The first one is, since the standard has been on the books, our ability, I'm sorry, my name is Cynthia Rice. I'm from California Rural Legal Assistance, Inc. And since the standard has been on the books, which is a very short time, our ability as a statewide organization to provide very explicit and reliable information about what workers can expect in the workplace has been increased monumentally, and their ability to rely on it and tell other workers about what those protections are has created more confidence in the agricultural worker community and other low-wage worker communities. And I say that because there were a number of employer advocates who suggested that it might be appropriate to do some carve-outs for compliance with collective bargaining agreements, or with compliance with county-based or CDC or other based guidances. That's where we were before, and it created confusion. It didn't create conformity. And I would urge, when looking at the standard, the permanent standard, not to go back to a situation where workers and employers have to refer to third-party guidances or standards in order to determine what compliance and what protections will be. Second, another comment was made about the fact that the identification or the triggering of responses based on workplace would be inappropriate in certain settings because of the fact that there would be multiple employers involved, and that the standard should address and place the responsibility on that employer with respect to an exposure caused by his or her employees. In the current agricultural situation, where we have farm labor contractors and growers working together increasingly on 50 to 60% of the fields that are out there, and sometimes more than one farm labor contractor or subcontractor for irrigation, et cetera, it is critical that the requirement for addressing safety standards be placed on the individual or the entity responsible for the workplace, and that is consistent with how OSHA standards, both regulatory and statutory, have been established. That needs to be consistent in this regulation as well. We cannot create a situation where the regulation allows an employer to, excuse me, point to some other entity and say, oh no, that's the individual who has to be responsible for the testing. And then finally, a very small point, there was a comment, I believe, by Mr. Miller with respect to the federal housing standards and the potential conflict with respect to the protections provided under the regulation for employer housing, and an indication that that might conflict with federal law and that such conflict would be improper. In fact, almost every federal standard that applies to the workplace in California, with notable exception of the National Labor Relations Act, is not preemptive, and that's certainly the case here. The federal standards in housing set the floor, not the ceiling, and to the extent that we can implement standards that provide greater protection to workers who are housed by their employers in these times, it's important that we do that, and that if the federal standard is inadequate, we address it. Thank you very much, Chief Parker, for allowing the extension of time so that I could make these comments, and thank staff for the incredible work that's been done on this standard in a very short time.
Thank you, Cynthia. Appreciate that, and thanks for your comments. We're at time. I will give a brief recap of the issues that we're going to be focused on as we prepare for advisory committee meeting. So some of the things, and I think this goes for some of the issues that we're going to be working on with respect to FAQs under the standard as currently written. Exposed workplace, of course, is a big issue that that people have asked for clarification on, and people have made recommendations about how that and the intersection with outbreaks and testing might be changed in a future standard. That we look a lot of comments on testing, both in terms of the requirements and the practical challenges, but also the from some stakeholders, the importance of early prevention. And so there's a lot to work through there. And then, as I touched on before, the issue of what is an outbreak, the scope of an outbreak, whether, who it's limited to. We're going to be looking carefully at people's recommendations. We want to make sure that it, whatever we do, that it's, kind of risk and hazard based as we look at how we might clarify or consider changes to those sections. And then lots of questions on quarantine exclusion and exclusion pay, which we're going to be clarifying and under the current standard, as well as looking at some of the suggestions people made and having that on at a topic of an agenda of a future advisory committee meeting. Privacy is another issue. And then, of course, there's a number of things that people have asked for clarification on certain definitions: business day, COVID case, notifications, periodic inspections of the workplace and what that means, frequency of training, and a number of others. Fixed work location was another one, I believe. And then comments on the notice provisions and how those interact with legislation. That'll be another issue that we assist with. And then several comments on transportation, a number of comments on housing, and then various comments on the structure of the rule, the relationship with CDC, CDBH guidance, and how there might be flexibility in the rule. We'll be looking at that. I want to just mention that we are mindful of limitations that we have in rulemaking with respect to the administrative code, and then we're mindful of the scope of our authority with respect to rulemaking. There are some recommendations or suggestions that have been made that may exceed that authority, and so we may not be able to consider all suggestions or recommendations. However important they might be, they are a priority. The issue might be they may not necessarily make it to the table in the advisory committee meeting because of that. So I just want to clarify that for folks. And then some of the issues around scope with respect to hospitals, how we account for controls when there are guests and others in the workplace. Cost, of course, was raised multiple times. um, let's see, how exclusion pay works, the importance of considering additional retaliation language, if there are further recommendations on what that clarification might be, in addition to current law, that would be helpful to know. And then issues around information sharing, notification, and privacy, a lot of interaction with privacy. Eric, did I miss any major topics that that people raised that we want to make sure that we are at least considering to put on the agenda for the advisory committee?
No, that seemed a pretty comprehensive overview of all the comments. I just want to know, I have a couple staff members who are experts in COVID-19 and infectious disease, Susan Eckhart and Michael Wilson. I don't know if they have anything else to add on the recap. I'll give them a chance if they would like.
Well, hi, this is Susan. Oops.
Go ahead, Susan.
Yep. Hi, this is Susan Eckhart. I want to thank everybody for all your wonderful, well thought out comments today. And we'll work hard to get them all sorted out and categorized and hopefully answer questions, in the near future through the FAQs. And if you have any additional comments that you'd like to send us, either like written or just in an email form, or if you have questions that you would like to ask, please email them to the mailbox that we've been referring to, the rs@dir.ca.gov. Thanks.
Mike, anything to add?
Yeah, I'll just say, this is Mike Wilson. We have about 16 pages of written notes from people's comments. And of course, we appreciate everybody's, the written comments that have come in through letters and also on the email site that Susan just mentioned. We're carefully looking at all of those and really appreciate everybody's time today, spending such a long process with us to convey all the information. It's really important, and we'll put it all to use.
Yeah, I'd echo that as well, and I just want to commend everyone who participated today in the thoughtfulness of their comments, the fact that folks took seriously our request to keep this constructive and focused, which I feel like it largely was, or almost entirely was. And I'm deeply appreciative of that because it really helps us do our job in carefully considering the changes that folks have mentioned and the need for clarification of the existing standard. So very much appreciated. This was an emergency standard is an emergency standard that we put together under the strict terms of the what's required and what's allowed for development of an ETS. And so it didn't get the stakeholder input that we would normally like a rule to have because of the urgency in implementing it and the instructions to that effect and the concerns that the standards board and that we had about delay. And so it's great to have the opportunity to hear from people and to understand their points of view on some of these issues. So again, I thank everyone. I know it's getting late. My background is, well, the sun's behind me, so there's still light, but it's dark that way. So anyways, I'll close unless anyone else has further comments from Cal OSHA or any last questions. I will answer a question some people may be having, which is when is the advisory committee meeting and what's the structure? And we'll be consulting with the standards board staff on that and get information to you as soon as we can. Thank you.
Thank you very much. And that concludes today's forum. Happy holidays, everyone.
Yes, happy holidays.